Sandra all the time is here with a cold heart true. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra.
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth telling, more problem solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. All right, folks. Happy Tuesday. Good morning to everyone. My apologies. Had to restart this monster of a machine every once in a while. I should have not touched it. I shouldn't have tinkered with it, but there you go. Tinkered with it, and it was like, no, 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 no. You're pressuring me today. So that required a restart. I think we're all good now. So good morning to radio listeners. Bobo 103.1 now. And of course, we want to say a big morning to all of our social media folks. 300, almost 300 people in the live stream already. Wow, look at you guys. Shout out to Instagram. I see you over there. And we are going to get this show on the road. So good morning. You know, it's Tuesday, and we are in the middle of a campaign season, silly season, as they say. But there is so much going on. But we're still here for the educational segment. So I don't want you guys to, this is like summer school, right? You're kind of hyper focused on election madness. Summer school, you're hyper focused on having fun, vacationing, but you can't forget your core skills. So we keep it going. We keep the classroom tight, and we keep your educational segments going. And of course, Tuesdays, for the most part, are dedicated. Hey, how are you?
Good morning, Sandy. Good morning. I just had a little bit of a glitch there with
Backdrop here. That's what I was trying to do when the computer got stressed out. It was,
yeah,
oh, I can't take any stress right now. But let me update that to the beautiful slide from Health City, Cayman Islands.
definitely, definitely. Can you hear me now, Sandy?
Oh yeah,
I
I
went
can
in
hear
and out.
you.
Okay, perfect,
Yep.
perfect. Well, beautiful day, as you say, and yes, time for some education. As always,
Yes.
glad to be here on a Tuesday. I think we had missed 2 Tuesdays in a row. We were on Thursday, but
Yes.
it's good to be back home on Tuesday. And
Absolutely.
today we have Dr. Indu. She is the consultant for obstetrics and gynecology. She has close to 2 decades of experience.
Mm-hmm.
She is a specialist when it comes to high risk obstetrics cases,
Mm-hmm.
adolescent gynecology, menopause related issues. She's also trained in minimally invasive gynecology procedures. And she's been on the program before, and we briefly mentioned that she's so unique. She actually worked as a gynecologist in the Indian Army. At some point in time, we have to ask about that experience.
Yes. Wow. Yeah,
But
I think
definitely,
we need to have a sit down with her about that one because that sounds pretty cool.
yeah, definitely. Looking forward to the segment today,
Mm-hmm.
which is understanding endometriosis.
Yes, I feel like you guys are testing me with these these medical terms because this one is definitely a tongue twister, and you have to really take your time pronouncing this. So, Dr. Indu, good morning. How are you? Uh-oh, there we are.
Good morning. Hi. Hi, Sandy and Shomari. So nice to meet you again.
Yes,
Yes.
thank you so much for joining us. So we've got
And
a tongue twister this morning, endometriosis. It's like
yes.
you can't say it too fast because
Yeah.
it's a little bit of a not really a tough one, but you gotta break it down. So of course this is such a interesting, I've heard of this before, obviously, as a woman, but
Yeah.
I suspect that there are a lot of people who don't know what endometriosis is. So let's start off there. What is it?
Endometriosis, actually it is a disease. Ladies perceive it how what is, first you have to understand what is endometrium. Endometrium is the inside lining of the uterus, the womb,
Mhm,
which sheds every month. So every month a lady menstruates. So the endometrium, it comes out and it then starts building again. So that's a
mhm,
cycle. And that's 1 month cycle, which we call it as like menstrual cycle. And it is
mhm,
very important for the normal functioning of the female reproductive system. And it is influenced by hormones. But this is what a normal cycle is. But uterus has three openings.
mhm,
One which through which the blood comes out, which we see, like people are using menstrual pads, tampons, so many things.
mhm,
The other two openings are the tubal openings. There are tubes connected to the uterus which open in the abdomen.
mhm,
So actually what happens when the blood is coming out through the one opening, the big one, when it is coming out through vagina, some of the blood through the tube may spill into the abdominal cavity. But
Mm.
if that is the case, then every lady should have endometriosis, but it doesn't happen. So that means this retrograde menstruation theory, retrograde means when the blood is going through the tubes into the abdomen and the blood is spilling over the ovaries, over the peritoneum, and the adjoining tissues, causing endometriosis. So endometriosis is when the endometrium is found in any other place except the uterus. The lining, when it goes out of the uterus and it is found in the abdomen, and it bleeds every month at the same time. When a lady undergoes menstruation, just like the endometrium is coming out, similarly, wherever it is in the abdomen, that endometrium bleeds, it causes same cramps, same pain, and it is called a sticky disease because first of all it's very difficult to go with treatment. It comes back again and again, and whatever is like wherever is the endometrium,
Mhm.
it will keep make everything sticky, like your bowel, your bladder, your uterus, ovaries, tubes, they all will stick together.
Mm.
Okay, so
Mm.
like, but like ladies, patients, they ask me, ki, doctor, if that's so, then we all ladies should have endometriosis because this phenomena is happening in every female's body.
Mm.
So there comes the role of other factors like genetic factors, autoimmune factors,
Mhm.
hormonal factors. So exactly, even as of now, no
Mhm.
doctor, no theory can prove that who are the ladies who will have endometriosis and who will not have endometriosis, and how they get it, at what age they will get it. It's so difficult, but this is one field where a lot of research is going on. We know what are the high risk factors, we can tell them, but still concrete explanation is not there. It's just all theories.
Yeah.
And
So there's some, just let me clarify and make sure I understand what you're saying. That so there's some, people who are affected, normally ages 15 to 49. And it's interesting that you can actually get it so young. So we
yeah,
probably have some parents listening to the program this morning. Moms, pay attention because your daughters might be complaining about pelvic pain, and you may think it's just regular cramping, and it could be something a bit more serious. So even as early as 15 years old, during your more reproductive ages, 15 to 49, and an estimated 1 in 10 women worldwide actually are affected by endometriosis. So,
yeah,
look around a room. You're at work now, perhaps you're in the car, you're listening to this show in different places. You know someone who has this. And the thing is, a lot of women in particular will suffer through health concerns in silence because they don't know what it is. They don't want to seem like they're complaining. You know, you don't have to suffer in pain when you have when you can get a proper diagnosis for these things, and you can get the medical professionals to help you. So some risk factors here. What is retrograde menstruation?
retrograde menstruation is what I just explained. It is the most commonly accepted theory where retrograde is something which is going back against the flow.
Right.
So I mentioned those two tubal openings. Through that,
Yes.
when the blood spills in the abdominal cavity, that is called retrograde menstruation. But
Mhm.
if that is the case, that is happening in every female's body,
Mm.
but not like incidence is just 1 in 10. It should be then 10 in 10 if that is
Right.
the theory. Okay, so what happens, blood is falling in every lady through the tubal
Mhm.
openings, blood is going into the abdominal cavity, but that gets cleared by your body's immune response.
Mhm.
Just like so many things are happening in our body and we don't even come to know. So
Mhm.
similarly, but there are few ladies in whom due to some alteration in the immune factors, genetic factors, hormonal
Mhm.
factors, body is not able to clear that blood, and sometimes it gets spilled over the ovaries, over the peritoneum, and then endometriosis starts growing.
Right. Okay. So, at the very beginning, when it starts, are you going to see symptoms right away? or does it take some time for
Uh,
symptoms to present themselves?
I'll tell you, I have seen patients who are just 13, 14 years old who have
Wow.
not even started their menstruation, and they
Mm,
come with pain, and we have found endometriosis. So that is why even genetic factors play a
mhm,
role. Now that's why it's coming up, because if we take the retrograde menstruation theory, then
mhm,
periods have to start at least. But there are incidences, cases reported where a girl has not started her periods and she's having endometriosis. So
mm,
actually, the it is common in the reproductive age group, and
mhm,
the commonest symptom is pain. Most of the patients first they will come with the pain that doctor, we are having severe pain, and pain is very particular. It is not a typical pain which every patient gets in periods. This pain will start even before your start of periods, and this will pain will be there throughout the cycle number of days you are menstruating. And even when you have stopped menstruating, you can't see any blood, then
mhm,
also there will be some amount of pain because of the inflammation and all those mediators which are released, which induce pain. So that is why it is called triple dysmenorrhea or transmenstrual dysmenorrhea. That means which stays throughout the menses, before
mhm,
that, even after that. So that is very typical. If
mm,
patient can tell us this type of history, then
mhm,
it's very easy to diagnose. And the other symptoms are, apart from pain, yes, painful defecation, like when patient gets up in the morning to pee or to poop, then she will feel a severe pain, especially while passing the stool, because sometimes your rectum is involved. So that is also a very typical symptom. And infertility, most of the patient they just land up with infertility and then we diagnose. So actually endometriosis, if not diagnosed early, can lead to infertility, and lot of patients we get who are suffering from infertility and they're diagnosed with endometriosis.
hmm. Very interesting. All right. So there's genetic risk factors, folks.
Hmm.
Early onset of menstruation is also risk factor. So
Yeah.
before age 11, what percentage of the female population, doc, has to deal with early menstruation? Because before the onset of age 11, that seems very, very early. So what percentage of young girls are dealing with that?
If you have a strong family history, like if your mother, your aunts, your grandmother, if they suffered from this type of problem, endometriosis, or they have undergone surgery due to endometriosis,
Mhm,
and if a young girl complains of repeated pain episodes, lower abdominal
mhm,
pain, then we should be careful that she may have endometriosis, because genetic factors is coming up very strong.
mhm,
It's not that common before
mhm,
age of 20, but yes, cases have been reported. So
mhm.
genetic factors are equally important. So if you have a strong family history, you have to be very, very careful about
Yes.
developing endometriosis.
Yes. Huh. Interesting. Another factor is having a short menstrual cycle at less than 27 days. So the average menstrual cycle is 27 days.
27 to 28 days. So
Right.
if a lady is getting periods every 21 days, every 22 days, for
Mm-hmm.
example, she got it on first and then again she got it on 22nd, 23rd. So that means that you are having multiple cycles. So there comes the role of that retrograde menstruation theory, which I explained in the beginning. More periods, more spill of the endometrium in the
Mm,
abdominal cavity, and that is a triggering factor. So actually, females who have short cycles,
mhm.
they will not develop it, but they are high risk. They are prone
Yeah.
for
And let me
endometriosis.
just give we might have women who don't even know what their cycle is. A lot of women don't really track it. They have an idea. I'm going to make a suggestion here. There's actually apps that will help you track these things. And I use one that is actually very, very good. It tells you like your ovulation window, and I've used it
Yes,
for
yes.
many, many years now. There's, I'm sure, more than one out on the market, but there's one very, very colorful one. It's called Monthly Cycles. And you can put in all sorts of details in there, because sometimes you go to the doctor, they're like, okay, when did your menses start the last time versus now? So
That's
there's
the
a lot
common,
of,
most commonest question. Yeah.
yes, I mean, anytime you go to the doctor, they want to know that. But yeah, you can, there's information here that is so helpful. And you can also track, like if there's certain times that you're having, a heavier flow or you're having more cramping, it just makes you more cognizant, because I think women just kind of, we have to go with the flow, so to speak, no pun intended. But you just kind of jump up and you just keep going. These things can help you track this information, so that if
Yes.
it's something that the doctor is trying to figure out that could potentially be going on with you, if you're able to track it, then you have a much better chance of giving them accurate information. So Banana Orchid says, thank you for covering this topic. Good morning, Miss Debbie. Gabby says she used another one called the Flow app. This is the beauty of technology, folks, is that you can have these apps available to you right on your phone. And I'm just trying to log into mine because it had logged me out. And you have good information that you can track all the details. So it tells you, for example, what your average period length is, average cycle length, if you have any symptoms, when you start and stop, and when you're ovulating, all sorts of things in there. And so that's a good idea to be able to track that for the physicians. I think it certainly makes their life easier. Also, if you've never given birth before, that's also a potential risk factor. So very, very interesting. So let's talk about what women should be looking for.
I just
Because
want to add, I just want to
yes.
we tell patients uh, who are prone for endometriosis not to delay their pregnancy, because pregnancy causes amenorrhea. So for 9 months there will be no periods. So even patients who are having very mild endometriosis, and if somehow they are able to get pregnant, they are lucky, they just get pregnant. There are patients who, with even with endometriosis, they will get pregnant. So that 9 month of amenorrhea during pregnancy actually is a cure for them. It will heal them. It will sometimes even eradicate the endometriosis from the roots. So pregnancy is one of the cure for endometriosis,
Mm-hmm.
because
Wow.
9 months no periods. Yeah.
So it can actually cure it even after you've had the baby.
Yeah, if you had the baby and
Mhm.
earlier you had a struggle in conceiving your first baby, there are chances that for second time you will conceive very soon. So pregnancy kind of, it makes your system very like disease free from endometriosis.
Interesting. Very interesting. All right. So, very interesting. Let's look at some of the common symptoms then, so that women know what it is that they're looking for, because sometimes these things can mimic, other issues. So we have severe pelvic pain, especially during menstruation. So how do you know that it's not just regular cramping? Because some people have really bad cramping. Like, is it a degree of severity that you should be looking for?
Yeah, definitely. Even a normal menstrual cycle, there will be
Mhm.
dysmenorrhea, and there should be dysmenorrhea. If a
Mhm.
lady is telling that I'm having painless periods, I don't feel even the slightest of pain, that is
Mhm.
abnormal. That is not the normal menstrual system. You should feel slight pain in the lower tummy, in the thighs, in the backache on the first
Mhm.
and second day of period. That is normal. But if pain is excessive, it is not relieved with the medication, you cannot go to work, you cannot do your household duties, if it is restricting your movement, and if it is like causing trouble in your daily lifestyle, then and the pain, if sometimes they just take painkillers, first line, second line, sometimes they come to the hospital, but usually patients complain, patients who have endometriosis, that the pain doesn't go even with medicines.
Mm.
Yeah, every
Mm.
month. So it is that severe. So if a
Right.
patient is giving history, then we
Yeah,
should be uh, investigating on those lines.
on
Yes.
those lines. Okay. All right. So some other symptoms that we need to be looking out for and encouraging women. This is really about listening to your body, ladies, and paying attention. And like I said, sometimes if you're a mother, listen to your daughters, the things that they're saying to you about how they're feeling, and don't just make assumptions that if they're complaining, that is normal. So what are some other symptoms, Doc, that we should be looking out for?
As I mentioned, there may be some premenstrual spotting. If a girl, every month she reports that before starting proper flow during the period, she's having spotting like some brownish discharge or like altered blackish brown, dark color, dark red color discharge just before the periods, 2 3 days, or maybe 4 5 days, then that premenstrual spotting is very common in endometriosis. If she is regularly having it, like for consecutive 4 5 months, then we should investigate it. And if periods are irregular, like short cycles, sometimes it is short, sometimes it is long, there is no regularity in the period, she can't track her cycles, that is also a sign of endometriosis. In between the two cycles, if there is spotting, that is also maybe a sign of endometriosis, because uh, the hormonal imbalance and all those things are causing it. And
Mm-hmm.
as it, like I have mentioned before, there may be severe backache, abdominal pain, and like
Mm-hmm.
normal symptoms of menses. There may be some bloating, there may be some pedal edema, nausea, vomiting. So all these symptoms also may be exaggerated.
Mm-hmm.
Not in all patients, but yes, in some patients.
Yes. Okay.
And
Wow.
not to miss is the infertility, which I have already discussed. The infertility is if there is infertility, and if patient tells that she is having severe pain, like in last 1 month, I have got 4 5 patients of infertility with endometriosis. So
Mm-hmm.
endometriosis is actually very common, and we should rule out other factors also, like just a lady is complaining of pain, so we can't label her as having endometriosis. So
Mm-hmm.
we should rule out there are no fibroids, there are no PID, any infection in
Mm-hmm.
the pelvic cavity. Once we know that nothing is there, and with endometriosis, a very good thing is that you can diagnose it actually, doctor, with a good clinical examination. Per vaginal examination, we are able to see things which may tell us that she's having mild, moderate, severe, what kind of endometriosis. And
Mm-hmm.
then there is ultrasound, definitely to aid us, help in diagnosing endometriosis. But the definitive test is
Mm-hmm.
laparoscopy. So sometimes, when we have got patients where pain is very severe, and we know it may be like 90% chances there, it may be endometriosis. We go with the
Mm-hmm.
laparoscopy, we take the biopsies, and we confirm it. So the confirmatory test is
It's a laparoscopy.
yes.
Yes. Okay. Part Journals says in the past, doctors used to discount your pain as simply menstrual pain, and women of a certain age weren't diagnosed with endometriosis until later. Talking about these issues with young ladies in secondary school is important, and establishing regular checkups with their gyno can also assist with so many issues. So thank
Yes,
you so much for that.
definitely.
And she's absolutely right, because the earlier you get a diagnosis, I'm sure the sooner you can get to having some of the possible treatment options available to you. And there's no need, ladies, to suffer unnecessarily in pain. I think we have been conditioned in a way to think that pain is normal, and that even excessive pain is normal. I know that there's so many women who every single month they miss work, they miss school, young girls, because they're in excessive pain during or right before their menstrual cycle, and they kind of discount it as, oh, this is normal. This is something that I have to tolerate and put up with. And of course, you don't have to, and that's why it's important to educate yourself. And then, if you have daughters, to make sure that they know what some of the things are to look out for. And there's no shame. I'm so happy that we're having this discussion. Someone, Banana Orchid, says, thanks for covering this topic. There's no shame in having these discussions. Men should also know that, sometimes these are some of the things that women have to go through and they have to deal with, because ultimately a woman's body is different from, a man's body, and a woman's body is designed for childbirth and to go through these processes. And it's not always easy. You don't appreciate, that little machine they've been simulating, like what it's like to have labor pains, and they put that in men. And most men are like, oh, like at level 2 or 3, they're like, take it off. I can't take it anymore. Appreciate the women in your life because they bring life into this world and they make so many amazing contributions. So educating yourself about what women are going through, I think, is incredibly important. So, Doc, let's talk about some of the available treatment options because there is something that you can do about it, right? You don't just have to sit and suffer.
So, treatment options, especially this disease, like there is a long age group from 15 to 49. So, treatment options actually they vary according to the patient's symptoms. If there is a 15-year-old girl, her only concern is pain. She is not worried about her fertility issues, her childbearing, and all those things. So the main concern in every class, every age group is the pain. So we have to address the pain. So first let's start with pain. For pain we have painkillers, but painkillers also we follow a step ladder pattern. It's not like that we give the strongest painkiller in the beginning, and we don't know
Mm-hmm.
the pain thresholds of all the patients are different. So we start with the first line painkillers, which are like NSAIDs. They are the safe: ibuprofen, Compiflam, paracetamol. They are given. Usually pain is relieved with these first line medications, but there will be few patients who come up again and again. They're like, no, this medicine is not working, give us something like add on. So then we have to move to the second line painkillers we give, but like they have to be given in a moderate fashion. We just can't because they are not that safe. Then comes the third line, and if pain is not relieved with the oral medications, then we may have to switch to the injections. Patients like come to ER or they go to clinics to get injections. Yeah.
Mm-hmm. All right, folks. So those are some of the available options. Now, I do have a question from one of our listeners. Let me just pull it up on screen here. She says, unfortunately for me, I do have endo. Even after doing surgery, I got no relief. They said some of the tissue was beneath nerves, so it was too risky to remove them, as I might end up with bowel issues. So they would have to go through the back. The pain is debilitating, and it is in my hip and radiates down my leg. Oh, wow. Is robotic surgery something I could consider, or am I better off doing pain management? So this is someone who's already gone through the surgical option, and unfortunately, the traditional surgery has not worked for them.
So actually, as I mentioned before, that it's a sticky disease. It
Mm,
comes back again and again. So
mm,
once we have got patients who have undergone surgery 3 times, 4 times for
mm,
endometriosis, and yeah, they don't get 100% relief is not possible until or unless we remove everything: uterus, ovaries, tubes. We have to do that. Is the radical treatment is the only cure, but obviously we can't do that because every patient's requirement is different. Like
mhm,
they want to keep the uterus to preserve their fertility. So in these type of patients, I can see what is her complaint. Sometimes when endometriosis it goes deep, it may be like 5 millimeter, one
mhm,
centimeter. It may involve your rectum. That is why patients are having
mhm,
pain while passing stools and all. And sometimes when your nerves are involved, usually the
mhm,
sciatic nerve and all, they carry the sensation to the legs. So nowadays there are surgeries available, robotic
mhm,
or laparoscopic, where they go and they just free your nerves, and definitely that is life changing. Yeah, robotic surgery is definitely one of the option where the
mhm,
nerves can be released. Those it is called rectal shaving. We remove all the endometriosis deposits on the rectum. We shave it off, like just we remove whatever safely we can remove without injuring the bowel and all.
mhm,
And it really helps, but it depends on the expertise, like where you are getting the surgery, by who's specially working in it. There are doctors who are specially just doing endometriosis work. They are not doing anything else. So it's
mhm.
better to go to them for this type of surgery rather than going to a general gynecologist.
Right. Wow. And have you done this surgery yourself? This one that you're speaking of now?
I don't do that extensive surgeries like releasing
Yes.
nerves and all. But I know
Mm-hmm.
people, there are people who are doing it. But yes, we do, like for infertilities we do, for pain we do. So when we know that it's just endometrioma or mild radiations, till that we are doing. But as I mentioned, endometriosis has grades. Grade 1, 2, 3, 4. 4 is where everything is covered. You can't see uterus, you can't see ovaries, it is all covered by bowel. So a lot of that's very extensive surgery.
Mm-hmm.
It
And of
depends on.
course, Health City Cayman Islands has Dr. Roy Gatcliffe, who does the robotic surgeries. And
Yeah,
my understanding is he has experience doing
he
this.
yeah, he may be doing this type of surgeries. I'm not sure, but he's a actually cancer specialist.
Not
But he,
Troy, my apologies.
yeah.
So I was going to say, my apologies, that this is one of the great things about Health City Cayman Islands, Shamaris. They bring in a lot of consultants and experts if they have to and make them available at the facility. Sometimes they're visiting consultants, and then obviously sometimes they're here all the time. So
No, no,
very good.
definitely. So, Sandy, so for the most part, we have our physicians with us full time,
Mhm.
especially when you need to have those multidisciplinary type of scenarios where you're looking at the best solution and you can get all the physicians in one room to look at the
Mhm.
treatment plan and what would work best. However, there are, chosen physicians from outside of the facility that, depending on speciality,
Mhm.
that meet the ethos, as well as the quality of what we're looking at as Health City, that we're able to bring in as well. So Dr. Troy Gatcliffe is definitely one of them,
Mhm.
and you would also know, even we have headache specialists and the such, and we'll also have some more moving forward, seeing as we have the new facility. But the great news is, I even recall when we lost our last gynecologist.
Mhm.
You kept asking, when are you going to get
Yeah.
another gynecologist? When are you going to get another gynecologist?
Yes.
Especially a female gynecologist. And
Yes.
we now are
Yeah.
pleased to have Dr. Indu with us as well. So we have two that are
Mhm.
with us, and they're quite busy now, but definitely
Mhm.
they still have room for anybody who would like to
Yeah.
see either of our gynecologists. That I'll give you the
And
details
I
shortly.
Yeah.
want to add on that, like we have delivered three mothers with us, and the delivery was like just like how we planned. We
Mhm.
could give epidural and the babies, everything, midwives. It was a wonderful experience for the patient also, and in no time, like patient was attended. Uh,
Mhm.
so we are doing good in that also. We are
Yeah.
getting
So the maternity ward is open, folks,
yeah,
at Health City
yeah.
Cayman
We
Islands.
already
The NICU
yes.
is open as well. So delivering babies already. Wow.
So that
That's
that would be another program just by itself to talk about our
yes.
our first Hell City babies.
Oh my goodness. So
And they are
exciting. All
all
right. So
so cute. Yes.
treatment, yes, treatment options, lifestyle and alternative therapies. So we've already talked about, medicine and surgical treatments. And of course, one of the things I really appreciate about Health City is the fact that, if there are other options available to you that would work, acupuncture, physical therapy, exercise and yoga, diet, and nutrition, they always push those things first and foremost. Do what you can do because your health is oftentimes in your hands. Pain management, if there are things that you can do in terms of lifestyle changes, they encourage you to do that. Only go and see them when you absolutely have to, like the pain is not manageable by any other means. That is when you then can go into Health City. So yes, Doc, you wanted to mention anything in relation to that?
I just want to like my piece of advice that it's very difficult for patient to understand whether they are sometimes even the normal menstrual pain is so severe that they Google is available nowadays and they assume that yes, we are having endometriosis. We get,
Mhm.
even in Health City, I have got so many patients who come to me, doctor, I'm having this and that, and I'm sure I'm having endometriosis. So I said, how you got to know about it? So they were like, no, my symptoms are like this. I examined them and they were absolutely free of endometriosis. So actually, whenever in doubt, if you feel that you may have, it's always better to visit a doctor once, just
Mm-hmm.
to know whether you have it or you don't have it, or you are
Mm-hmm.
going to have it. So yes, like one visit they can just give if they are having this doubt, because nowadays Google is there, it will tell you so many things. It will like overburden your mind, you can't think straight.
I'm I'm glad that you say that because yes, I always tell people we're all now at Dr. Google. You know, we all
Yeah.
think that we have all the answers. So
But
it,
Google will not
it's
let you take even a paracetamol. Google will say this can happen, that can happen.
yeah, absolutely. All right, folks. So, of course, just keep in mind that, the real experts are available to you and they have years of experience diagnosing these things and they know exactly what it is to look for because there are a lot of times that there's symptoms that can mimic other things. And so you need a proper diagnosis. And like she said, the definitive way to get a proper diagnosis of endometriosis is not Google, but it's to actually have the laparoscopic procedure where they can actually test for it. So thank you so much for that. And of course, Health City Cayman Islands every month is having promotional things. We're going to talk about that here in a second, but we do have Anisha who has a comment. She said, "Good morning. I did 3 surgeries, and the last one was 6 years ago, and that was epidural. And from time to time, I've been having lots of pelvic and lower back pain. I took painkillers numerous times to help ease the pain, but the pain is getting worse now where I feel like my back is burning me instead of hurting me. My pelvic feels swollen as well. Any advice?" So this is something she should definitely come and see you about.
Yeah, what I can understand, like
It's
three
three
surgeries,
C-sections.
uh, undergoing 3 surgeries, that means she's having a high grade endometriosis. And whenever we do the surgery, we could correct some amount of it, not 100%. And even if we remove it 100%, it will come back
Mhm.
again till the time you have not attained menopause or you are having hormone production in your body. So this disease actually, that's why it is so difficult to deal with. That like with other disease, we just remove them and they don't come back easily.
Mhm.
But this, till the time you attain menopause, you are 50, this will keep on coming. So
Yes.
it's not the best option to undergo surgery again and again. But
Yeah.
there are other options available, like there are pills, there are injections which you can take once in 3 months, once in 6 months. They will cause a kind of amenorrhea, which will actually give you pain relief to a greater extent. So yes, there
Mhm.
are other options available.
So to be clear, she corrected. So she's had 3 C-sections where
Mm.
she's had epidural each time. And she's saying now after the three
Okay.
C-sections, she's having this pain. So do you think this could be linked to the epidural?
Uh, Epidural is the thing like which we place in the spine. So most of the patients, not here, almost I think in every country, they believe because something went into their spine, so their backache
Mhm.
is due to that, but it's not. Like we doctors, we also undergo deliveries. We get spinal epidural. Like as Scott has mentioned, I was working in Indian Army and I used to
Mhm.
daily have a 5 kilometer run in the morning. So
Mhm.
we female lady officers, we also undergo pregnancy, and also definitely it is not related to that. Epidural, even a male who's undergoing a hernia surgery or something, they
Mhm.
also get epidural or spinal. So,
Mhm.
backache, if you are having severe backache, it's better to visit a doctor, get one MRI
Mhm.
spine done. There must be something wrong if your pain is that much that it's burning, or
Mhm.
otherwise, if everything comes okay, just some
Mhm.
physiotherapy, some counseling can help.
Yeah. So
Okay.
Anisha, go ahead and make an appointment because again, it might not be related to anything with your female organs. I know sometimes in our heads we're thinking, okay, we're linking it to the epidurals or the 3 pregnancies, but it could be something else. And the beauty of Health City Cayman Islands is they've got under one umbrella, one facility, all of these experts that are available. So, I have been there before speaking to the gynecologist and I needed to go and speak to the surgeon, the breast surgeon, to look at my mammography, my ultrasound scan for the breast, and he was right there and available, and they could just shoot me over in his office. So it's very, very convenient to have all of the expertise there. It really is. It really is amazing. Yeah. Wow. Anisha says thank you. And of course, Shamari, remind people before we talk about your upcoming promotions that they can always reach Health City. Now you've got two very, very convenient locations as well.
Oh, definitely. And you can call the same number, which is great, and ask to if you need to see a physician at a specific location, you can ask the same number. So it's same 345, but it's 640-4040, info@healthcity.ky, or you can go on our website, healthcity.ky, to try and figure out what type of physician you may want to see, and or download our Connect app. And from our Connect app, you can go ahead and book an appointment either with our GPs and or our gynecologist, or if you know specifically which physician you need to see, you can go ahead and book that from our app as well.
Yeah. All right, so let's talk about a few things that are happening promotion-wise. Of course, March is Colon Cancer Awareness Month. They've come on last week talking about that very, very important cancer. You can get your colonoscopy at Health City Camana Bay now at reduced rate of US $2,000. That includes the procedure and follow-up consultation if needed. Early detection, folks, is the key for most of these treating, not for most, for everything really, for treating and diagnosing and even prevention, because colon cancer is one of those things that you get polyps early on, and they can tell what's going on with those polyps. So please don't let this month and this special go by where you don't get it booked. A lot of insurance policies, including my own, actually covered it. So
Correct.
yes, so you
So
can
that was the point. That was also the point that you call to make an appointment, Sandy, and we will be able to tell you whether or not your insurance is going to cover it. But if not, the actual price is US 2,000, which is actually doing it a little bit less than cost. So that's a good price as well.
Yes, absolutely. And you've also got another promotion coming up here. I see Leroy calling us, but I know he's not calling in relation to the guests, so we're gonna answer him once you guys leave. But you've got your Catwalk for Cancer event, which is happening this Thursday. So
Yes.
tell us a little bit about this event as well.
Yes, so all the proceeds go to the Cayman Islands Cancer Society. Catwalk for Cancer has happened quite a few times. And it's Thursday, not Wednesday, like I would have said last week, but Thursday the 20th at 6:30 at the Paseo at Camana Bay. Tickets are $75, and you can get them at Sand Angels, at the Cancer Society itself, or AME. I'm not sure if you pronounce that or if that's an initial. I don't know the actual store, so you might have to help me with that one, Sandy. But definitely go get your tickets and come out this Thursday, 6:30 p.m. All proceeds go to the Cayman Islands Cancer Society.
Yes.
And they do such a great job over many years. Prior to them being around, there wasn't as much screening as would have occurred. So they've done a great job ensuring that a lot of the ladies get their breast cancer screening done. And we've seen where over time, that segment of the population is getting the treatment, as well as at times based on insurance. Insurance may be up and or there may be issues, and Cancer Society has done a great job actually stepping in to help the community to be able to gain the access that they need. So we try and be a great partner to CICS, and they're also a great partner with other medical facilities on island as well.
Yes, and I know you guys do a fantastic job supporting NPOs. They, Health City, they don't brag about this. They just do this kind of stuff silently. But there are times that you'll see some NPOs on here. They have given up their slot for them to come on and promote their organizations. So we have this comment this morning. Someone's listening. That says, "Morning, Miss Sandy. I used to have pain so badly that I would puke, and I had to have my right ovary removed because of severe endometriosis." Girl, oh, I'm sure I sure don't miss that pain. Ladies, please, if you get yourselves checked, if you notice any of the symptoms. So this person has been through it. She has suffered. and she finally found relief. I'm sure removing an ovary is not an easy decision, Doc. But if it's that bad, you might have to look at that option.
Yeah, but
Oh,
sometimes you don't need to remove the whole ovary because
okay.
endometrioma is a cyst which is there in ovary. So removing the endometrioma is a better option than removing the whole ovary, because
Okay.
even the slightest part of ovary is, even if it's left behind, it will
Uh-huh.
give you hormones for like 5 years, 10 years. So
Oh,
it, yeah.
okay. Interesting. So you
So
can remove
the
part. You can remove part of your ovary.
Yeah, as a doctor, our aim is to remove the cyst first, to correct the anatomy, to
Yeah.
remove as much endometriosis as possible, but not the ovary. Because removing the ovary will take away your hormonal drive totally.
Yes. Okay. Wow. So fascinating. And I'm so happy that you have this experience. Now, Doc, we're going to do a sit down with you because I want to learn all about being a doctor in the Army because that sounds fascinating. So you said every morning you had to go for a run. You can tell us all about that when we do a sit down interview. But you must have seen a lot of situations, in that former life of yours that now you can apply to private practice.
Yeah, exactly.
Mhm.
There, the number of patients are high, and because it's a closed organization, our
Mhm,
patients don't go outside. They will come to us with
mhm,
everything. So, all the complications, emergencies,
mhm,
obstetric, OBGY, gynecological, all the big cases, you have to manage on your own. And you are working in a closed organization, so you don't have even a helping hand. If you can't
mhm,
manage patient, you have to transfer them to the higher center. You have to air evacuate, airlift, or something like that. But
mhm,
yeah, it gives you a lot of experience. That is why uh, everything, whatever is written in books, I have seen almost all the cases and have done almost all the surgeries. So in that way, that experience is very helpful. Yeah.
mhm.
But in
Absolutely.
army, first we are treated as a soldier, and then we are a
Yes.
doctor. So
Yeah.
that life is also there,
Very
donning
interesting.
uniform and all. Yes.
And Sandy, just to mention, I just got a message. So
Mhm,
El Madani, which is Dr. El Madani, which is one of
mhm,
those physicians that aligns with the vision of what we have, actually has privileges to work
mhm,
with us at Health City, and his
mhm.
patient just delivered. And so we want to tell her, I'm not going to say her name, but we want to tell her congratulations. She's actually listening to the program as we
What?
speak.
She's delivering. She's listening to the program. Oh my gosh.
Yes, I'm sure.
That'll be
I'm sure. Baby
that'll
in
be a
hand,
new fan right from the womb.
uh, baby in hand, listening to the program. So huge congratulations to
Aw.
her and
Yeah.
Dr. Al Madani as well, who
Oh,
will
wonderful.
become part of the Health City family. And as we are working together, obviously with deliveries.
Collaborating.
So
Yeah.
we have our team, and then we also have extensions, as you would have mentioned
Mhm.
previously. I
Well,
know Dr. Al
congratulations.
Madani.
Did you have a boy or a little girl?
That I do not know, so I'll
Okay.
have to ask that question.
All right. Well,
But
congrats, Mama. This is it's amazing. It is such a beautiful facility. Our listeners have seen it, and I've toured it. And if I were going to have another baby, which I'm not, that would
sure.
definitely. Oh, I'm sure that would definitely be the facility of choice. But thank you so much to Shamari Scott, who is the Chief Business Officer there at Health City, Cayman Islands. He keeps himself extremely busy, bringing not just this program, but we're going to be doing a lot of special interviews throughout the year. You've seen some aspects of the facility already, and of course, Dr. Indu. Is it Gaur?
God. Yeah.
Gaur. Obstetrics and gynecology is her specialty with a wealth of experience that she brings now to the new team. And there's actually two physicians that have expanded the women's health section of Health City Cayman Islands, now doing maternity, expanded it in terms of their team, midwives, the whole 9 yards, folks. So your babies are in good hands. So this would make baby number 4 that has been.
Um,
Baby
I'll
number.
have that's baby number 3. Yeah.
This
Okay.
is baby number 3 this morning that was
Yes.
delivered.
Yes. So
Yes.
so
All right.
Dr. Indu knows all the babies that are coming through. So
Yes.
that's baby number 3.
First baby was a male baby. second baby was a female baby, and this even I don't know, but yes,
Yeah. Chances are it's
You'll find
probably
out
a
shortly.
female because I think we tend to have more females than anything else.
We
But
need more
thank you.
boys, more boys, more boys.
I know. That's your job, Shamar. You
Hey,
did your
I,
part.
I
You
did my
did your
part. I gave you three boys. You can't ask me for any more than that.
part. Exactly. So thank you so much to both of you for coming on the program today.
Thank you,
okay.
Sandy.
Thank you
Don't
so
All
forget,
much.
right.
Sandy.
Have a
Thank
good
you.
one.
Okay, bye.
This is where we come when we need special care. Grandpop says the doctors here take the best care of his heart. And Auntie, she's getting ready to check on my baby cousin. She won't tell me if it's a boy or a girl, because she says I can't keep a secret. They call this place a hospital, but for me, it feels like a world where people always find what they need. Grandpop's heart, Auntie's baby, and even Daddy's injury that Mommy says is just a paper cut can get special care. It's a special place where you always find the care you're looking for. You'll feel it too when you come here.
All right, folks. Welcome back. So beautiful. Everybody good? Everybody's in class? We do have some other guests. We're just waiting on them to pop on real quick. I'm just checking to see where they are. So let's just give them a quick second here. And then we're going to take it from there. While we're waiting on them, please go and vote in the poll. How was the, who won the, who won last night? The poll, the candidate forum, the chamber candidate forum. All right, let me just see here. I'll throw this up. Nope, I don't see her. So let me try sending her just another link. Okay. All righty. Right. Good morning, Miss Michelle. How are you, beautiful? Okay, Instagram folks, let me just restart your feed. And we're going to be talking about, I know a lot of you are here. I see you, at least 363 people. Oh, this is so ridiculous. Sorry. I'm looking at some of what's happening in the States. I let me not get started on them, honey child. So let me just see here. Yes. So I know you guys are here to talk about the video, which we're going to get to in just a little bit after our second set of guests. We won't be long with them. So just hang in tight there. This is some good information that's good for you to know. But please go vote in the polls. I think that the general consensus is that Michael actually did very, very well. Unfortunately, the candidate for the other party, Progressives, did not do too well, but we'll talk about that once our guests are done. So we've got Cassandra joining us this morning. Good morning, Miss Cassandra. Is it pronounced Shay?
Shay, like the butter, Shay.
Yes. All right. So we've got Miss Cassandra Shay from CNCF. She's here with us, and she's head of theater and festivals for the Cayman National Cultural Foundation. She's going to be talking about the K-Fest events that they put on every single year, which culminate in the Red Sky at Night event, which is happening this Saturday from 4 to 11. So Miss Cassandra, fill us in.
Okay, super excited to be on the show. Thank you so much. This Saturday, of course, you know, we have the much beloved Red Sky at Night. I saw you last year. I'm hoping to see you this year. It's going to be a lot of fun. We have the most vendors we've ever had, ever.
Nice.
And we are going to have workshops. We're going to have performances. We're going to have film. We'll have the main stage activated. We'll have the very, very, very loved Caymanian village that's going to be activated with all of our traditional heritage and crafts and traditional practices. So rope making, the smoke pots, conch blowing, traditional games, peppermint making, coconut cutting, like everything. Smoke, yeah, everything. And the caboose will be out, so you'll get to see that in practice as well.
Yeah, wonderful. No, this is an event that I always look forward to. And if I'm here and I'm on island, I try to make it out because it really, as you say, it's a culmination of all things Caymanian mostly.
Yes.
You've got music, you've got artwork, small businesses get to go out there and show what it is that they do, which I think is amazing. So I always take extra cash with me because, of course, when you have a little girl, she's going to see something that she wants to purchase. Yep. And the food, I'm there for the food. And I love the peppermint making. That's actually probably one of my favorite things because I know that there's so few people left who are actually making peppermint, the traditional Caymanian way of making it. Now, the lady who you had last time, she's from Cayman Brac, right?
Right. Yes. And so we have a few people from BRAC coming down. And then we have, of course, like the Turtle Center doing some demos. We do also have the UCCI dance, UCCI pan players. They'll be welcoming us at the entrance with from 4 to 6, playing some of our favorite pieces that we love to hear. And then it's just going to be a great day of just culture.
Mm-hmm. Yeah, it's a fantastic event. The music is phenomenal as well. So it's just always a fantastic time. So tell us the details of how people can come out and enjoy, bring the entire family out on Saturday.
So on Saturday from 4 p.m. to 11 p.m., we will be having the grounds of the Harkwell Theater, which is on 17 Harkwell Drive. It's right next to the National Gallery, if you know where that is, for people listening in. And then it's also, people can park over at Caymana Bay and take a shuttle over. Tickets are on ticketsplus.ky. They are $5 and $10. We keep it very affordable. We do have a ticket price change at the gate, so we suggest everybody buy their tickets online first because it is more affordable that way. And you just secure your spot. You want to have that security to say, come on through, I have my spot already, and it's a lot smoother process. And speaking of music, by the way, Swanky will be performing. They're our headliners, and so they're going to be performing for us in the evening.
Fantastic. All right. Sounds like a great time. Get your tickets. Is there a way to pre-purchase tickets for the event?
Yep, all on ticketsplus.ky. So you can get them at Tickets Plus. And then at the gate, you can also pay, but that will be $5 and $15. So $15 for adults, $5 for kids. Online, it's $10 for adults, $5 for kids.
Right. So early bird special. Do it online. Absolutely. You get it a little bit at a discounted rate. So that's always awesome. So yeah, this is exciting. And then that's this Saturday. What else do you want to tip us off on? What else you're planning? I know CNCF is always very, very busy. You've always got a lot of fun stuff that's going on. So what else do we have coming up?
So many. We have been doing so much for K-Fest. So as you probably have seen, we've had over 20 days, about 22 days of K-Fest celebrations that has started from international panelists to dance workshops to workshops from our grants recipients like Benil Miller, and then even Red Boat Experience that just happened on Sunday, which is from Randy and Nasaria Sakushalet's performance, which was amazing. We had K-Fest on film, which was at the cinema. So keep an eye out on our platforms at Cayman Culture, and you'll be seeing a lot more of us in the near future.
Oh, fantastic. All right. Well, thank you so much. Is there anything else that we need to know? Wear comfortable shoes.
Yeah, bring comfortable.
My recommendation. Yeah. Take a little sweater because you're normally there for a couple hours into the night, and sometimes the weather gets a little bit cooler as the sun goes down.
Yeah. You sound like a pro. You already know. You know how it goes.
Yeah. Take the kids because they're going to have so much fun, and make sure they're dressed for the occasion. Go with an empty belly because lots of good food there as well.
Yep. I appreciate it. Thank you so much.
Thank you so much.
I'll see you there.
Yes. Bye. Fantastic. Have a good one. All right. So good stuff. I love it. All right. We got a caller. Good morning, Leroy. Good morning. I see you've been trying to give us a call.
Yeah.
Yes, sir.
Miss Sandy.
Yes, sir.
I don't know who sent that message, but I would like to know because I even had a call Philip Wood last night about it and say he don't know nothing about it. And I have not even commented on your profile for the last maybe week. I just like
So
go
of
to
course
work.
your our listeners don't have any idea what you're talking about. So let's just back it up a little bit here, Leroy, so that people are aware of what you're talking about. So you have been blocked on CMR, and
Yes,
you
ma'am.
were asking
Yes,
why
ma'am.
you had been
And
blocked.
yes, ma'am. And
So apparently you were
I think
on,
one of
I
my
think it was
coworkers.
March the 8th.
I no, no, no.
Uh-huh.
Listen, I all right. I work at Eastern on New Rubis.
Mm-hmm.
Okay, you know that.
Mm-hmm.
I put my phone there to listen to your conversations because I like your blog. At some point, I have my opinions. Don't get me wrong,
Mm-hmm.
but I would never, ever cuss on somebody's blog.
Mm-hmm.
Okay? Never. So
Mm-hmm.
somebody went on my phone when I made it went round the back and had a cigarette and decided to type in some BS.
Mm-hmm.
And I know you're still on radio.
Mm-hmm.
Yeah, you're still on radio. So
Yes.
so I'm gonna be very content. At the
Mm-hmm.
end of the day, I will never disrespect you. You
Mm-hmm.
knew that, and you always know that
Mm-hmm.
because I always make my little jokes and everything.
Mm-hmm.
But whoever decided to say, well, what they said, and they said it, it's either they troll my Facebook page or they went on they saw my phone on the gutter and they
Mm-hmm.
decided to type in some stupid BS. Understand?
Mm-hmm.
And let me tell you something. I have
Mm-hmm.
some enemies out there. And right now, I went to the hospital under a court order to get detox. Okay?
When you say detox, detox from what?
From alcohol
From alcohol.
syndrome.
Okay.
And I'm doing very good right now.
Right. Is it possible that that night you could have been having a moment drinking and don't remember commenting on the live?
No, 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 no. No, 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 no.
Okay.
No, no.
Right. So of
Oh
course
no.
you can understand from our position, we wouldn't know who has your phone from who doesn't have your phone. And there's certain things that we can't allow on live
I
streams and
understand that, Miss
so
Sandy.
so that's
And
that's why you got blocked, but then
me
you
and
kept
you have
you
been good
kept
friends for me and you have been good friends for over 10 years.
yeah.
At
Because when you kept
least.
asking why you got blocked, I'm like, I don't know, let me go and check. And when I started having a look at it,
And then this guy
apparently
to the wood, I called him last night and he
Mhm.
can't even tell me why I got blocked, but he tell me that I'm a troll. I'm
Mhm.
like, I'm like, who the F are you?
Mm.
You know, who
Mhm.
the F are you to
Mhm.
tell me to get blocked because you live in a rich man estate? You know,
Mhm.
listen to me. I live with my parents, okay,
Mhm.
and I deal with one problem every day, okay.
Mhm.
I'm sorry, I'm gonna cry,
Mhm.
but I deal with one problem every day. I have to work. Number one. Number two, I have to
Mhm.
deal with two parents with dementia. I
Mhm.
can put money down there. You can put money down there, say
Mhm.
$25, and I am at work and they accuse me of stealing.
Mhm.
These have come to my workplace, accuse me of stealing.
Mhm.
Understand? And I'm
Mhm.
trying to go through the system where I don't want to depend on nobody. Really, I want to be like you. You know, I want to be able to buy the G wagon I want to be able to buy the house. I want to be able to. But when my grandfather died in 2011,
But you know,
it
Leroy,
crushed my
those
it
things.
crushed my heart.
I know it
You know,
sounds like you
listen,
need some therapy, but those things, I want to tell you something. Those things don't bring you happiness. There's no material vehicle, no house, no nothing that is going to make
I
you
don't want
happy.
I don't want
If
vanity.
something
I
else
don't
is
want
going on.
vanity, Miss Sandy. I don't want vanity.
Yeah,
At
but
the end
this
of
is what I'm
the day,
telling you. These things are nice to have, whatever. But if you're struggling with some other issues, that's where we want you, because as you say, you have become an integral part of the CMR family here. We enjoy you coming on the show, you know. But we want
I
you to get
enjoy
help. We want you to make sure that you're okay.
I enjoy your show, and I would never ever do anything to harm your show.
Mm-hmm.
I always put up positive things. I always say, well, you know, Sandy, you're doing a good job here.
Mm-hmm.
You know, when I saw Christy put up that thing the other day, Sunday, you know how much that hurt me?
What was that?
And I
I'm not
couldn't even
sure.
reply. I couldn't even reply
Which thing was that? I'm not sure.
that that Wayne Patton is
Oh,
supporting.
that young lady. Yes.
Yeah.
Mm-hmm.
So, you know, at the end of the day, I try to support you and I love you as a friend. And your
Mm-hmm.
brownies, I love them. You only bought them for me maybe once or twice, but I love them. And then I hear on the show in the gas station that, oh, you know, she's sleeping with Wayne Patton. That's why Wayne Patton doing this and Wayne Patton doing that.
Lord Jesus.
I said, listen to me. Wayne Patton, he got more money than Quaker got oats.
Yeah.
I said, that man there loves you. He loves you to death because he knows that you got his support. Understand? But at the end of the day, I'm gonna tell you the truth, Sandy. We need to unite. We need to stop dividing. This dividing thing is not gonna work. You know. So I know one Caymanian, and I'm really hoping that I can get back on your show. You know, I even
Yes.
got people at gas station, you know.
Mm-hmm.
Um, and I'm not gonna mention it, but I'm gonna call her name. Look, Rhea Elliott. She is saying to me, "Oh, you should resign and this and that because I got court cases and this and that."
Mm-hmm.
So I'm gonna put this to you,
Mm-hmm.
right? I'm going to drug rehabilitation court,
Mm-hmm.
and I'm trying to clean my life up.
Mm-hmm.
And you know how much it hurts?
Mm-hmm.
I was in the hospital for 1 week.
Mm-hmm.
1 week. I had 3 needles in me. One through my spine,
Mm-hmm.
one going to a machine, one going through my left, and one going through my right arm. Okay? And you know something?
Mm-hmm.
I feel so much better right now.
Mm-hmm.
I'm not going to work today because I'm depressed.
Mm-hmm.
Because of what someone said to me yesterday.
Mm-hmm.
I'm so depressed. So um I'm gonna ask you a question, right?
Mm-hmm.
And if you answer it, I would like you to be a supporter on my addiction. And if you're willing to do it, I'm happy.
Mm-hmm.
My wife is helping me, but at the end of the day, it doesn't make no sense. Because I go to this counseling and sometimes they just make you want to write down stuff that comes with center. But when you counselor they got there now, it's more like they write on a whiteboard and everything. And then I'm dealing with a guy named Brandon.
Mm-hmm.
He's gonna try to help me. So but if you want to help me, if you want to support me, I'm so happy.
Yeah. I mean, listen, Leroy, the comment section, of course, everybody is blowing up to say, we want you to get better. We don't necessarily understand everything that you're going through. It sounds like a lot, but you're a good person and you just need to get in, a better space, right? And the professionals, they're in a position to help you. Because I think that, as once an addict, always an addict, from the perspective that once you start to have a bad moment, you tend to revert. If you don't have the coping tools, you tend to revert to the addiction. So they're there to help you, and we will support you in any way that we can. If this platform means that much to you, I'm going to, because I have a very strict policy about not unblocking people, because people get blocked for a reason. But if you say that wasn't you,
I got a great physician. His name is Richard Hessen. Hessen. He's very good. Very good. So if you ever want to recommend him, he's very good. I'm really doing pretty good. I'm drinking a lot of water, Gatorade, and fruit juices and all that right now. So at the end of the day, I think I'm cleaning my life up, and they gave me diazepam, thiamine, folic acid because I have a trio sickle cell plus a multivitamin. So at the end of the day, Miss Sandra, I would mind if you come by and talk to me at some point and give me some advice.
Yeah. I mean, the best advice that I give people, Leroy, because I know my limitations, is that the professionals are there to help you. They're the ones who are trained to do what they do. That's why I support organizations like, Alcoholic Anonymous. I support the Alex Panton Foundation.
Well,
I support all of these mental health facilities, Caribbean Haven.
I am going to AA twice a week. And it's helping, Yes. And the only thing right now that drug rehabilitation court is finding on me right now is what they call Darapin, which is not a drug. It's a medication. So I give you a little bit of knowledge right there. It's diazepam. Diazepam is what's like. If I drink, I turn upside down. Yeah.
Yeah.
So, Miss Sandra, I really love your show, and I don't know which administrator put me off, but could you please get that administrator to put me back on because I really love your show. And I think I have to keep my phone a little bit more safer. Because I think it was one of my co-workers that typed in some BS.
Or Leroy, don't text when you're drinking, if that's the case. Because sometimes we're drinking and we don't remember what we're saying and what we did. So, drunk texting is never a good idea.
Madam, I'm off on Saturdays. And I was at the hospital that Saturday. Okay? And I was laying down in that bed. And I wasn't even watching your show. I was pretty much watching my football games. Okay. So somebody showing me. But I gotta let you know something. I have a Facebook page up. I guess you know that, right?
Yeah. So listen, a member of the HSA board has reached out and they've offered to get you help at the HSA. I will send you their information on WhatsApp because there are a lot of people listening here this morning, Leroy, that you're really touching. And we just want to make sure that you get the help that you need and that you're in a better space, right? So maybe all of this had to happen for a reason, because had you hadn't got blocked, I'm sure you wouldn't have called in today. And so, this might now push you in the right direction in terms of getting some serious help.
I didn't hear what you said because I turned off the speaker. Sorry.
Yeah, no, I just listened through the phone, but what I was saying was that someone from the HSA board has reached out and they're willing to get you into the HSA and get the help that you need. So what I'm saying to you is, this phone call would have never happened if you hadn't been blocked on the platform. So maybe that happened for a bigger purpose, which is for you to, really get the help that you need and focus on your recovery. So, this is only a talk show. CMR, the talk show, the platform. It's not a lifeline for anyone, or it shouldn't be. It's what it is. Keep it in proper context. I know you enjoy it, but
I've gotten help from HSA already. I'm going to court because my parents are suffering from dementia. Some days they're good, some days they're bad. Okay? You wouldn't even believe what my father told me on Tuesday morning. He wants to borrow my debit card and put money in my account to pay the bills. Whenever he had Eastern Avenue, 171 Eastern Avenue, the laundromat. I said, so how all of a sudden you've been paying these bills and now you need my debit card? You're going to try to fuck me over or what? I'm sorry.
Leroy. Okay.
I said, you all trying
right.
to mess me over.
Leroy, we probably don't need to get into the family business, right? Keep that. Yes, we understand that you have some issues, but we don't have to get into it because I know your emotions are going to change if you start talking about the details of it, right? If you need any more help, I'm going to send you a contact number for a board member. If you require anything else.
Miss Sandra, what you can do for me?
Yes.
You know exactly where I live. Because you done brought me a prize. And I would not mind sitting out with you outside in some nice fresh breeze of Halifax Road. And we talk about this one-on-one because I think I need somebody. And I've talked to the culture film. And they say they don't have nobody that can talk to me one-on-one. Besides Brendan. Okay? I said, the one that took my intake from court, Kathy. I said, couldn't she talk to anyone and I can get her out of the promotion? You know? I want to see Caymanians. I want to see Caymanians uplive their life. You understand?
Mm-hmm.
I don't want to see Caymanians downfall. Like yesterday, that was stupid. Where a Filipino is delivering
Yeah,
a
we're gonna get into that. But Leroy, let me ask you just to leave me there, please. Go and get some rest. I'm going to, because I don't unblock people often. I don't really. I have to look for where to do that, right? So I'll look for it. I will unblock you this one time. This is the one second chance you get.
I don't mind.
Please ensure that you don't get blocked again. Okay?
I don't mind. I do not talk about ganja because I don't do it. I don't talk about cocaine.
Mm-hmm.
I don't talk about my abuse. I try to talk positive things.
Mm-hmm.
And I just want to know one thing that you can do for me.
Mm-hmm.
Please do one thing for me. Put the progressives on. Put every part.
That is outside of my Leroy. You're asking me for something that I have to be honest with you. I can't force anybody to come on. I can't deliver that. So let me explain to you what the progressives have said. I didn't even know that this is a dream of yours, I guess. This is a request that you're making, but I can't force anyone to come on the program. The progressives have said, okay, they cannot come on the program. They can't do anything with CMR. This is coming from the top. This is coming from Mr. Joey himself, because Barbara Connolly is upset about things that we've said about her in the past. And so their loyalty is to Barbara first and foremost. And they know that she would not be happy if they came on the show. So they're not worried about what if you want them to come on. They're loyal to Barbara because she has been a stalwart in their party. This is basically what I was told. And that she has, worked hard in the party. So they don't want to upset her by turning around and coming on CMR. That's the reason. I'm just telling you as an FYI why they will not come on this show.
I got one last thing to say.
Okay.
One last thing to say.
Mm-hmm.
I'm going to give Alric all the praise.
Mm-hmm.
I really hope he gets in. He came very close last time.
Mm-hmm.
And I really hope he gets in.
Mm-hmm.
I'm not a Georgetown West. I'm a Georgetown East.
Mm-hmm.
So at the end of the day, I really have prayers for Alric.
Mm-hmm.
I'm going to pray for him because at the end of the day, I think Alric I've talked to Alric many times through the gas station, on the road, everything. And this man has a very good sound mind. So at the end of the day, I really, really pray that Alric gets it.
Okay. Thank you, Leroy.
And I hope it's not because of your platform that he gets in. I hope he gets in because we need a good, stronghold. We don't need people that just say, well, we're going to get 12 and $15,000 a month because we're going to sit down there and talk blah, 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 yeah and no.
Mm-hmm.
Nah, yeah. Understand?
Mm-hmm.
We need people that are going to say, this is the right thing, this is the wrong thing.
Mm-hmm.
Thank you very much
Thank
for
you.
listening, Miss Sandra.
Yes, Leroy.
I'm
Thank you
so
too.
happy. I'm so happy that I have somebody to support me at some point.
We're here for
And
you.
thank you, Mom.
All right, Leroy. Take care. Okay. Wow. Good morning, caller.
Good morning, Sandy.
Yes, ma'am.
Morning. I don't want Leroy to listen. He could be my son. Please, Sandy, if you have time today, he say want a one-on-one, go and sit and talk to him. I know the feelings. Please. And if anyone listening on the air, I know what it is for depression, they would try and find him today, because what I hear from Leroy this morning is under a lot of stress, and someone need to reach to him before anything worse happens. Please, someone go and talk to him, find him today and talk with him. He's a begging.
Thank you, Miss Lucille. Wow. So, it's mornings like this that are especially tough. I know Leroy has been struggling, and what I want to say is, obviously, when you have access to social media and you're going through certain things, that may not be the time to have your phone in your hand, because you might say things out of character. And so I know the things that were being posted were very, very egregious. And I had no clue what was going on. But, we couldn't allow that rhetoric. And I know that Philip Wood was, I don't know if he remembered exactly what was being said, but he did comment and say, Leroy, what are you going on with in this chat here tonight? It was actually the live stream for the TCCP launch, but it could have been any event. There's certain things that we cannot allow. And so that was why he got blocked, but he doesn't seem to have any recollection or memories of it. And he says now that he was actually in the hospital and that perhaps someone else had his phone. I don't know the circumstances, and I don't know, who allows people to have their phone. That's not something that I personally do myself. But if you do, you have to understand that there are consequences for certain comments and so forth that you might be engaged in. So, try not to engage in that, because that will get you blocked. And listen, I'm fair to everyone in the sense that once you're blocked, you're not getting unblocked. So this is the one time that I will make an exception, because I did see he was all over social media saying that he was really upset that I had blocked him and all this sort of thing. And I don't want people to ever, I know people obviously get really attached to this platform. Some of them get attached to me when you really shouldn't. I mean, there are people in your life that, your family, your friends, those are the people that you need. But I do get it to a certain extent, but I want you guys to be cautious, because CMR shouldn't be your lifeline. We're here to talk about community issues. I know we have a camaraderie, like I said on yesterday's program. There are times when I'm like, this is our family. We have our own little community here. We tell our jokes. We get to know each other. But if you're blocked in CMR, your life doesn't end, right? Your life continues. It's not the end of anything. And I do think that some people get very, very upset once they're blocked. And I don't quite understand it, because you're putting too much stock into this. And that's what I don't want you to do. Miss Joyce, good morning. Miss Joyce Ann.
Good morning. And don't let me hear you say you're not a lifeline, Sandra. Lifeline comes in so many ways. Yes, it should not be attached. It shouldn't be something that, you can't live without. But you could be a lifeline for the less fortunate, those that don't have a voice, those that are hurting like he is, I sat here and I cried. We live in good homes, we drive good cars, and our kids are good. They go into good schools. They got food, and this young man is struggling, it seems, just for love, for somebody to talk to him, to understand him. So don't say you're not a lifeline. What if that's how God is using you, Sandra? God uses us in mysterious ways, and you might be his hope. You might be that this morning he didn't have you to talk to. He gets so depressed and do the unthinkable. Yeah. But he come out, and I really appreciate that you took out the time and you allow him. I just wanted to hug him, and I just wanted to say, it's going to be okay. And, he's on the road because he's talking about it, and that's the biggest thing, when people could be honest and sincere about whatever it is. And he did, and my compassion is just so much for him this morning. I just want him to know that there are people out there, and I'm going to take him on my prayer list, and I'm going to pray for him. And if you allow me, I would love to pray for him, that he could hear this morning, because I am touched with people. That's why I'm not into politics. I've never been, but I'm into my people. I'm into my country. I'm into those that are suffering. I don't want to be, okay, I got things and I don't have to worry about those. No, I don't want to ever be like that, because you cannot be a child of God and you just selfish about you and your family, right? So you're doing the work for them. So you have to appreciate when they reach out. I don't think he's reaching out to say, you are my God. I think he's reaching out to say, you're my hope. You're helping me. And I can talk about it with you, and I feel okay to talk about it with you, So yeah, you're a line. You're a lifeline for some. Maybe the strong, no. Maybe those that got to hide, no. But for some people, yes. So accept it. You start for a reason sometimes, because God knows what people needs. And I know people criticize CMR. You got your good times, you got your bad times. There are times up and down, but everybody, we're human. There's not a perfect soul on earth. But it has been a help to so many, that the helpless, the voiceless, the rapes, the little child that had no one to stand up. People have gotten the courage to text you and to say, listen, this is going on in the house and whatever. So you're hope. Accept that you're hope. And if it's okay, I would like to pray for him.
Yes, ma'am.
Okay. Oh, Father, this morning, oh God, as we come before you, my God, you say rescue the perishing, care for the dying. And God, sometimes you use, like Sandra said, Lord, every source, Lord, to get to your people. You will do anything for just one of us, oh God. And Lord Jesus, it's just him today, God. I thank you that HSA reached out. I thank you, Lord, that Sandra's unblocking him. I thank you, dear God, he had the courage to say, Lord, he's detoxing, oh God. Oh my God, I pray this morning you give him the strength that he needs, oh God, the grace, and those that surround him, oh God, that they will understand that he needs, dear God, the love. He needs the support, God. Lord, these things take us further than we want to go and keep us longer than we plan to stay, God. We all have something, God, that has been through our life, dear God. And it's the same grace that you're extending to us, dear God. Lord, I know they say about CMR, but Lord, even about you, Lord, they criticize you. They Father God, ridicule you, Lord. They did every manner evil to you, God, and all you care about was the people. I've seen Sandra grow, Father God, and continue to grow. I pray this morning, oh God, as this election is going on, dear God, that everything that is done or said, Lord, that you will get the glory. You will direct us as people, oh God, who to vote for, Lord. It's not the best looking, oh God, or who we love or who we like, but God, through sake of our people this morning, my God, we want to choose the right candidate. Lord, this little island needs you, dear God, and we praying this morning, oh God, and there will be those that will agree, God, that you, Father God, have the last say. Bless Sandra, Lord, for all that she do by helping the wiseless, oh God, oh my God, this morning. Yes, touch. It's not just him alone this morning, oh God. There's so many out there that cannot speak. They're shame. They're hiding. They don't want to be known, dear God. But this morning, oh God, reach down, my God, and touch them. Those that have no food, Lord. Those that are struggling to send the kids to school. Those that don't have no gas or jobs this morning. Oh, Jesus, hear my cry. Do not pass them by this morning. Bless us now, oh God. Bless this little island. Bless those that are running, oh God, for politics, dear God. This session, dear God. And Lord, clean out the weeds, oh God. And let the righteous and the ones that mean, dear God, to help your people, Lord. Let them stand through the test of time and let them be the chosen one. In Jesus' name, we ask these things. And I say, Amen.
Amen. Thank you, Miss Joyce Ann.
Thank you so much,
Thank
sweetheart.
you very much.
Yes. Bye.
Oh, wow. Thank you very, very much. Philip said that he did call him last night and he apologized. And the two of them had a long chat and he encouraged him to get help and let him know that he can reach out anytime. Quite a few people now are reaching out. Another listener to the program says, and you are one of our lifelines, San. Love you. God bless you. Love and prayers to Leroy. And thanks so much to Miss Joy San. God bless her also. Love you all. Amen. Thank you so much, Miss Evelyn. You guys are making me very teary-eyed this morning. Says she's my therapy. True, Miss Joy San. She's my lifeline. I don't hear her in the mornings. My day is never the same. I feel so miserable and lost for the whole day. Oh my goodness. Thank you guys so much. Safinia says he confides in you, Sandy. Maybe you're the only one who he's comfortable talking with. Please find time to go and sit and talk to him. Lots of people feeling very, very emotional. Miss Darlene says, Sandy, can you block me until May the 1st, 2025, until we chase these crazy ball heads out of town? Oh my gosh, she wants me blocked for the election. Oh my goodness. Roar Cayman, yes. Miss Dawn, Miss Darlene. Marshall says, I'm happy that you answered his call and that you encourage him to call you whenever he needs to talk. I thank you for that. Speaking to Philip, Elijah, and Nicholson Coe, good morning to you, my dear. Michael LeMay, good morning. Sophia says, this show is tearful this morning. Lord, sometimes a good cry heals the heart. Ms. Beulah, thank you so much for your thoughts. Wow. Inspiring says, you are doing a very good job in our community. Only give second and third chances to all. All right, what a mess. Lavana says, thank you, Sandra, for listening to Leroy. He needed that. Roar Cayman says he sounds a lot better at the end of the call than he did at the beginning. Malachi says, I've always found Leroy to be a very ambitious person. From a young man, he was always hard at working, like a big man from a young age. Unapologetic said someone in his situation will never fully recover unless they realize they need help and actually ask for help, which it seems like he is now doing. So we want to encourage anybody who is struggling with addiction to please get the help that you need. There are professionals out there. I don't want to make anybody feel or think that I'm a professional, because I'm not. There are professionals who know how to handle addictions and addicts and all sorts of situations. And there are lots of amazing groups out there. King Nervasa says, I don't think that Sandy should be the one, but there are people in the community who specialize in mental health crises. And, I always seem to have people reach out to me, I'll be honest with you, throughout my life, that come to me, and then I pass them on because I respect and know my limitations. And so I pass them on to the professionals who are there. Lots of amens in the house for that prayer. Miss Beulah, Jeanette, Jim, Faith and Hope, Miss Pat, Miss Mona, Sophia, Irvlyn, everybody else, Robbie, good morning, to Gabby, everyone in agreement that perhaps we needed a little bit of prayer this morning. Donna says, amen, Miss Joyce Ann, I appreciate your prayers. Malachi says, if time may not permit you to meet with Leroy today in person, maybe you can communicate with Leroy off air from social media and perhaps on a video call on his personal phone. I will do that, Malachi. I will definitely reach out to him further after the show. Yes. Mirstar, thank you very, very much. Shamika, Miss Rose is here, Miss Lucille. So many people this morning really, really feeling it. Thank you, Miss Sonia. All right, Leroy, that's you. You're back? Is that your account? Sometimes people have different accounts. I'm not even sure. That's Junior Goldburn. That's a different account, I think. Prosperity Purpose says, if you didn't have an idea of the positive impact you have on this island, Miss Sandra, now you know it, Miss. Thank you so much. As with most things, you know, the negativity, which I know is a much smaller amount of people, is always amplified. So in my head, I guess intellectually, I do know it, but sometimes your heart feels it in moments like this, when people really, really reach out and they talk about how much the program means to them. Even when I go on vacation, I know a lot of you are like, don't go anywhere. We're going to take your passport. But yeah. All right. See ya. We're coming to that. Anisha says, I do appreciate you giving him the chance to speak. There are times when I feel so down and alone and I feel his pain. Please always find someone to talk to. A friend may or may not be the right person. Sometimes your friends are not going to understand. And, you know, professionals are there. I try to help in any way that I can. I had a young lady reach out to me last night, and she said that she was in need of some groceries and some gas money. And, you know, I said to her, because of course, I always want people to be self-sufficient. That's my goal in life. I don't want anyone to have to reach out to anybody for anything. You be self-sufficient and get on that path. That is the best. But we all have times in life when we do need help, whether it's just a phone call, whether it is a couple dollars. Everyone has gone through these situations, and I understand that life happens and things happen. So she explained to me that she has a job, a recent job, and she is waiting on her little paycheck. But in the meantime, she's having some struggles. And so when she reached out, and I was just happy to hear that she had a job, and she said she's looking for some money to be able to buy groceries and a little bit of gas. And I said, I will, you know, I will assist as long as I know that you're on the right path and you know, you're employed. Then that's important. And you got to keep your job. When you have a job, you don't quit your job. You keep your job so that you can continue to maintain yourself. Thank you so much. Eunasis, thank you. Marshall says, you are indeed a lifeline for so many. You may not see it as such, but there's a lot of people who are here for the good, the bad, the ugly, but they're here for one reason or another. All right. So Trisha says, it's great to see how much we still care. That's a village for you. Okay. Inspiring says, please unblock Alejandro. All right. So listen, where's Alejandro this morning? Is Alejandro listening to the program? Y'all gonna make me a big old softy. We're gonna have to do something about this, honey child. All right. Where's Alejandro? Y'all wearing me down. Y'all coming at me during election season to wear me down. You see what y'all doing? Sure. Where is Alejandro? Is he around this morning? Let's give Alejandro a call. Good morning, caller.
Morning, Miss Sandra. How you doing?
Good. Who's this?
It's Edward.
Oh,
I listened to you about the politicians.
that voice was so. I was. Good morning, sir.
I got a little cool and I get leaving.
By the way, radio listeners, I know the stream is about to end for you, so please join us on social media. Thank you. Yes, sir.
Yeah, I listened to you about the politician this morning.
Mm-hmm.
Barbara really should go back, to be honest, and I would like to talk to her. I'm going to try to see her today, if possible, or go to the office and try to encourage her, because she's young. I know Barbara from young, and she was doing very great.
But it's already too late. Nomination day is passed. She can't go back in.
Oh, well, another time then. Okay, the next one is the politician that running. Most of them, half of them don't have a law degree.
Wow.
You don't think that would make more sense to be fit in the law firm before you go into the political arena?
Well, not everybody has to be a lawyer necessarily. I mean, there are other skills that we need as MPs, right?
Well, the other skill I would be interested in seeing is to go around to the neighborhood and try to sit with them and find out where really hurting them. Like this lady, you say, in need of groceries and fuel and stuff like that. Then that would make some more surety to the people that you really mean something to the people in the country, you know? Anyway, me and you'll talk again. Thanks.
All right, darling, no problem. Well, sorry. I'm not sure he was quite finished. Sorry. So the people are saying, please, morning, Miss Sandra, please leave Alejandro where he is. I've enjoyed not hearing him. Yikes. Another person said, this one, hold on one second. Says, please do not unblock Alejandro. His message is the same on Radio Cayman. He has not changed. Ay. Good morning, Danny.
Morning.
Morning, sir.
I don't believe that ideas should be suppressed. They should be countered with facts. I'll leave it in your hand to ponder and make a ruling.
Thank you.
All right, bye.
So people don't get blocked because of ideas, to be clear. They get blocked because of behaviors and perhaps how they are expressing those ideas. So that's important to know. Carneth, good morning. Says, good morning, Sandy. I just wanted to take a moment to appreciate the amazing work you do. Your dedication to helping people and spreading positivity is truly inspiring. You've made a real impact on so many lives. Your kindness, wisdom, and encouragement remind us all that one person can make a difference. Oh my God, thank you so much. Please continue the incredible work that you do. You're changing lives and bringing hope to so many. Wishing you endless inspiration and continued success. Thank you. That means so much. Thank you very, very much. I really appreciate that. Media Warehouse, good morning. Sandra Cole is here with us. Good morning, Sandra. Sophia says, Sandy, you feel the blessing this morning. God is good, and he has used you this morning to shine on Leroy, and he will continue to use you to shine on others. Media Warehouse says, we're a community of second chances. Miss Darlene says, Sandy, you're a professional in your own way, because a lot are most supposed to be professional, don't know how to speak to people and don't believe that person's seeking the help. Sometimes it is because the professional suffered or suffers from mental illness and addictions themselves and not admitting to it. Lucky Body says, unblock everyone. Lord Jesus. Evelyn says, give him one strict warning. Yes, all right. Sophia says, unblocking needs to come with clause. What kind of clause? Oh my gosh. Thank you, Miss Leslie, joining us. Monroe, so good to see you on here. Donna says, I feel all the love and positivity this morning. We ought to be one another's keeper, Let's continue to lift each other up in prayer. Miss Pat says the HSA, the Counseling Center, Alex Panton Foundation, the Family Resource Center, Dr. Bodden, so many others are available. Please reach out. Tartarian says, warning, we need to talk. Huh? What's that about? Malachi, talk. Okay, message me, please, so I can reach out to you. Sophia says, leave him right there. Woo, I don't know. And unblock Jonathan too. Oh, now you're going too far. Oh my goodness. Justice will be served says Tuesday is beautiful. Wow. All right. Let's talk about this situation that has, YouTuber says Alejandro had so many warnings and he ignored every one of them. That is true. Oh, Sandy, you need to play the Rasclot song. Oh my God, you guys are so naughty. All right, listen. Over 700 people on the live stream this beautiful morning, 9:33 a.m. Happy Tuesday. By the way, someone reached out thanking me so much for the Health City segment. They said, a blessed good morning, Sandy, to you and all your listeners. Thank you for the medical and health segment. Very much appreciate it and great schooling information. I've messaged a friend to tune in as she suffers from a lot of back pains, and I was hoping this will assist her in a way. Do you have this medical segment every Tuesday morning? So the short answer is yes. Most Tuesdays we're here. The last couple of weeks it was on Thursdays, only because some of the physicians were otherwise engaged. So they had to take, time out of their schedule. Sometimes they have surgeries, like you might see Dr. Benoit come on, but then he has to run because he's a surgeon. And you never know when a heart patient is going to come in with an emergency situation. So Health City physicians are very, very busy, but they do take the time to come on the program and educate people, which I think is just amazing. And it's so amazing the people that silently listen. I know sometimes we don't always get a lot of phone calls, but people silently listen and they say, I recognize this in my own life or someone that I love. So maybe, I need to, as you did, tell your friend, go listen to this segment. This is something that would help you. We also re-air it on the weekends. So we clip out just their segment and we will re-air it normally on Sundays so that if you want to just watch their segment, you have an opportunity to watch it then as well. The person goes on to say, very, very touching with that male. God bless him. There's many going through such issues. That lady heart is as heavy as mine. I agree with her a million times. Your show is a platform for many reasons, such as this one. Bless her soul and for her words and prayers as well. Amen. So only ministers get second chances? You mean by the voters or what? I haven't had a minister get blocked yet. YouTuber says maybe you can do an addiction, a segment on addiction and like alcoholism. And I think that that's a phenomenal idea. And we'll reach out to Alcohol Anonymous so that you guys can know, because we were talking about them a couple months ago. But yes, I think it's important to know that these resources are available to you and there's help that is available to you as well. So please get the help that you need. These NPOs work and they do an amazing job to support our communities and to offer their services. And a lot of them really, really struggle with, oh, wow. That's a bit of good news this morning. A lot of them really, really struggle with resources. And so let me put this out there to any of these NPOs, especially surrounding mental health and wellness and addictions. You can always reach out to me, and I am more than happy to make this platform available for you and your services, for you to come on and to reach the people of the Cayman Islands. Health City, they've had a segment on as well, and they've talked about they have a mental health option there as well. They have a professional team, if you need counseling, if you need a psychiatrist, they have those people available as part of their team of experts. Okay. All right. Marshall says, okay, now it's time to deal with that crazy Caymanian in Prospect. All right, honey chat. Let me get the video. Hold on. Let me pull up the video. So let me give you the backstory here. I received this video last week, Tuesday, and I'll be honest, Leroy, that's you? All right. I'll be honest with you that when I first got it, I actually didn't watch it. And so I was, oh, thank you. Somebody just shared a list of mental health services just in case. Thank you so much. I'm going to share that. Appreciate it. Appreciate it very, very much. So yes, I was going to say that I got it on Tuesday and I saw a few of the comments. And so I didn't watch the video because some days, honestly, I get so much stuff. It is a little bit hard to keep up some days. Thank you, Malachi. He says it feels like a native Caymanian reunited today as we pull together in order to support each other. And you know what? At the end of the day, this is part of who we are. The video that we're about to talk about as well, I feel very, very aggrieved about. And I want to say this, right? Let me be very, very honest with you guys now. I'm a Caymanian and I have lived abroad in somebody else's, you guys didn't tell me my hair was sticking up, in somebody else's country. And I always believe, as someone who's had the privilege of being a guest, first as a student, I eventually got residency. I try to respect people from all walks of life, right? I don't want to judge people based on where they're from, who they're for. Like, I judge you on your behavior, how you treat me, how you treat other people, the things that you say and the things that you do. That's how I judge you. Okay. And so I want to give you guys a little bit of context before we watch the video and speak specifically about Sherry Ann, because Sherry Ann has been doing this sort of thing for a really long time. And I want to tell you how I have even been at the receiving end of standing up for expats when it comes to her. And she stopped talking to me for many, many years. You guys might not know this, but Sherry Ann is actually my first cousin. So listen carefully. You guys know I lived abroad. So I would not have grown up with Sherry Ann. I didn't know Sherry Ann. I came back to Cayman. And, you know, I met a lot of family members. You know, you meet people, you get to know them. When I used to go to the gym a lot, King's Gym, Sherry Ann was always there. I would see her at the occasional, once a year, basically, family event that my sister hosts. And yeah, she is loudmouth. She's out there. She's interesting, right? And many, many years ago, she called in on Radio Cayman and she was talking about Filipinos. It's interesting that this person's a Filipino. So I get the sense that she has an issue with Filipinos, which is really quite unfortunate. So she called in and she was talking about the fact that, and some people might actually remember this, but she was talking about the fact that, you know, oh, these Filipinos, this was a long, long time ago. Filipinos are horrible people. And, you know, they're all in the court system and this and that, and they're taking people's man, all sorts of stuff. And I was like, what? Now, listen, this was in excess of 15 years ago for sure. I found it so bizarre because even then, you know, I would follow the court system. I'd look at the cause list and stuff. And I'm like, it's not the Filipinos who are in the court system. You would hardly ever see a Filipino name, especially in those days, showing up in the court system. So I'm like, what is she talking about? Well, let me tell you what had happened. Apparently her boyfriend at the time, and this will give you a context of how long ago this was. She was dating Echard McLaughlin, I think is his name. Echard McLaughlin, Echard or Echard, how he pronounces it. Anyway, you know that's Alden's cousin, right? They all look alike, to be honest. Not for nothing, but she has a type. So she was dating him. And as some Caymanian men like to do, he was out there philandering and cheating and whatever, according to her. And I think he was, because she kind of caught him in a way. But she caught him with a woman that apparently she thought was a Filipino. It wasn't no Filipino. It was a Honduran, Spaniard. Go figure. But at first she thought it was a Filipino. So she called in the radio and radio came on. I'll never forget it, and started cussing Filipinos. And I was like, what? Filipinos taking your man now? I mean, I'm not impossible, but come on, girl. So that's what had happened. She was up in her feelings about this Filipino. And it wasn't even a Filipino. It was a Honduran. So, but you don't castigate an entire community and group of people just because one is cheating with your husband. I mean, come on. Or they're not even married, but boyfriend, whatever, your long-term behavior. So, our boyfriend, whatever he is. So anyway, I called in and I defended Filipinos. So y'all don't even know this. This is history now, right? And I said on Radio Cayman, I said, listen, I don't know what Sherry Ann's beef is with Filipinos at this moment, but she cannot call in and say all Filipinos are horrible people. They're all over the court system. They're this, they're that. I'm like, that's not fair. It seems like she has a particular issue with maybe one person. Again, it wasn't even a Filipino. I mean, this is a weird part. It was a Honduran. But I'm like, that's not right. By and large, Filipinos come here. They are very respectful people. They stay in their lane. They're very much about community. They do a lot in their little groups and communities. They have invited me even into their community. I've sat down at their private homes. I've broken bread with them. And, like everybody else, I will judge the individual people. So yes, there's Mary Jean. None of the Filipinos don't want to claim her either. They're like, she's a pariah in the Filipino community. She's taking advantage of everyone, including the Filipinos. So by and large, they come here and they try to do the right thing, right? They're here to work. And I don't think that you disrespect someone just because they're a foreigner in your country. That's not right. I have been a foreigner in somebody else's country. Okay. So after I called in on the radio and I made these comments, Sherry Ann stopped talking to me for years. Oh my gosh. Every time I would be in close proximity at a family event, she was always like mumbling under her breath and having something to say. I'm like, I ain't got no time for that. Like, it's just like, whatever. The negativity I cannot take, right? Now, I mean, I think if you know Sherry Ann, you know that she can be messy. For some of you, that's part of the appeal. It is what it is. I'm not here to judge her messiness, generally speaking, like in her personal life. Like, I don't really want to go there today. I'm just going to leave that alone. She has, with the whole WhatsApp thing, she's put together groups. And in her group, she always has the most to say. And those of you who follow her, years ago, she invited me to join her group and I declined because I know her up to a certain extent. And I'm just not into the drama being that close to me. When I started my platform, she was always sharing my stuff. She would send it out to everyone. I appreciated it. Then she stopped talking to me again. She got vexed with me because I was calling out her son, Jaron, to be accountable. Of course, that apple never fall too far from that tree. He doesn't want to be accountable. He wants to live a particular lifestyle and whatever. And, I still speak pretty well to the other cousin, Jason. I find Jason to be a little bit different, a little bit calmer at times. So, we have to take people as we find them. I'm not here to try to change anybody. That's them and their life. But Sherry Ann has a knack for crossing the line. And this video with her interrogating this Filipino woman who's trying to serve her papers has crossed the line. So let's watch the video for those of you who may not have seen it. And by the way, we have over 730 people now on the live stream. So here we go.
Yes, ma'am.
You Caymanian?
No, this is for government. I was just asked by the government to serve it.
But why are you delivering stuff and you're not Caymanian?
No, because we're working under government. That's why.
You are a Filipino working with the government?
Yes, ma'am.
How did you get a job with the government?
No, I'm working with Intelsec with Mr. Claude Miles. So the government asked Mr. Claude Miles to serve documents on behalf of the government.
So you're on a work permit?
Yes, ma'am.
And Caymanians need jobs? Thank you. Have a good day.
All right. So Sherry Ann obviously recorded this video, as you can see. And did the woman ever serve her? I am curious about whether or not she dropped the papers. Because if she didn't drop the papers or her foot, that's what she should have done. So listen, this is egregious. This woman was there to do a job. She was obviously serving some court papers. I don't know what the court papers in relation to. I'm sure we'll hear about it soon enough. But this is wrong on a lot of different levels. First of all, if the woman is serving you papers, just accept the papers. I mean, honestly, I don't know who you owe money to or what you're being sued for. I don't know if it's money, if it's defamation or whatever. I mean, only God knows what this could be in relation to. Whatever it is in relation to, right? I have been served papers. I have never refused to accept papers. You just take the damn papers. She is, I wouldn't even call her a messenger. She is just a delivery person. She's just delivering it, right? She works for a company that has engaged her service to go as a process server and deliver these to these different people. Take the bloody documents. How can you refuse to take the documents? And then you're interrogating her about what her immigration status is. I am sure the woman's immigration status is intact and in place. Why is that the issue here? And the fact that you have the nerve and the audacity to tell this woman, because she's not a Caymanian, what is she doing in your country serving papers? Come on, Sherry Ann. This is beyond ridiculous. Even for you, this is a new low. And I don't like it. And I don't know why you recorded this woman and then why you shared it, because obviously I'm assuming she shared it in her group last week, Tuesday, why I started to get it. And it's been circulating all over the place. Caymanians, let me be very, very clear. We are who we are, okay? We are not mean people. We're not hateful people. We're people under stress. We don't want the Larrys and Lindas here. But if someone is here legally in this country and they're doing a job, they're simply working, right? Who are you to interrogate them about their immigration status? Well, how did you come here? You have a work permit? Who has your work permit? You know, it's just too much. And so these are the types of things that divide us as people that is completely unnecessary. All she had to do, she wasn't doing a survey, Miss Brenda. From what I understand, she's serving her with legal papers. I mean, I need to get a copy of the papers. I'm trying to have a look at it. She's not, see? It's just something, and it looks like it has the government logo at the top. So it could be court papers or something. I don't know exactly what she's serving her. Maybe government was suing her for money not paid. I have no idea. But she's just like, here's the documents. It's a process server. She works for a company that does that for a living. Let me I can check the court list and see if I can figure out what she was actually being served if it's showing up on the court list. Because you can't deny service of documents. In fact, proper service of documents, and I know this for a fact because Mr. Frank Matfield, when I was serving him at documents, he refused to take it too, and the guy just dropped it at his foot. That is proper service of documents. So you can refuse them all you want. Once they drop it at your foot, that constitutes service. And once that constitutes service, then that's it. You have been served, honey child. And the process server only needs to confirm that they dropped it at your foot. And if you didn't want to take it, then that's your business. My God. What's going on with the public registers page today? It's not populating. Let me see. That's not coming. Oh, there it is. Took a minute. All right. So, I mean, again, I don't know who's suing her or what the papers are for, but the average person will just accept the papers and move on. This is ridiculous. This, unfortunately, reeks of racism. I don't even know what the other word is. It's just so incredibly ignorant that you would question this woman about her immigration status. I'm sure if Caymanians applied for the job and they want to do the job, which, by the way, not for nothing, but somebody commented about, yes, they have this type of business. And you know how many Caymanians they have gone through that refuse to, they'll take the job, get the first paycheck, and then that's it. They move on. They don't want to really work and do this kind of job because it's not easy, because sometimes you might end up dealing with assholes like Sherry Ann. Right? And some people are like, I don't want to deal with that. Who are these people? Just take the documents. It's absolutely shocking. And, you know, the young lady remained, I don't know who she is, but big shout out to her, because she remained respectful. I think she was just shocked. Like, you know, she's like, ma'am, I'm just doing my job. Listen to how she responds and what she says.
Caymanian?
No, this is for government.
She's these things?
Yes, ma'am.
You Caymanian?
No, this is for government. I was just asked by the government to serve it.
But why are you delivering stuff and you're not Caymanian?
No, because we're working under government. That's why.
You are a Filipino working with the government?
Yes, ma'am.
How did you get a job with the government?
No, I'm working with Intelsec with Mr. Claude Miles. So the government asked Mr. Claude Miles to serve documents on behalf of the government.
So you're on a work permit?
Yes, ma'am.
And Caymanians need jobs? Thank you.
The woman,
Have a good day.
the woman don't know nothing about if Caymanians need jobs. If y'all need jobs, you need to go out there and apply for the jobs. And someone just said, I'm going to show you this message. It's not that Mr. Claude Miles wasn't out there trying to find Caymanians to work. Y'all don't want to do this kind of work. You're out in the hot sun working. You know, it's not a luxurious job sitting behind a desk. Carrie Ann says, while we're on this topic, please ask Sherry Ann to give me my money back that she borrowed from me. What a hot mess. You see, sometimes when you're busy trying to make somebody else look bad and trying to shine the light on someone else, all you do is make yourself look bad. Because I'm sure Carrie probably forgot that you'd borrowed money from her until this came up again. This person says, oh, geez, Sherry Ann, FYI, Mr. Miles hired a lot of Caymanians, but they dipped their hands in the kitty too often, so he had no other choice but to hire a foreigner. Go figure. Nene, or is it Nene, said, so sad to see how evil people can be. Lucky Body said this brewing tension between Caymanians and expats doesn't look good and is progressively getting worse. Well, you know, for the most part, we get along. Both sides, I think, can meet each other halfway in certain things. But this is a primary example of what is happening in the community from a very small section of people. Most people don't do this. Most Caymanians would never do this. This is just rude and insulting. The woman is simply doing her job. Of course, Mr. Claude Miles must have her work permit in order. And until I see anything to the contrary, what is the issue? Sophia says this poor lady, as much as I agree with that Caymanians needs, that's not the way to go about it. And you don't take it out on the work permit holder. If you had an issue, right, and I'm sure Sherry Ann has Mr. Claude Miles' number, as we all do, go and call him yourself and say, well, why is a Filipino showing up to my door serving me papers? And I'm sure Mr. Claude Miles would then explain to you, Sherry Ann, or anybody else that cares to know, the volume of Caymanians that he's hired that either didn't want to do the job or kept, as that person say, taking the money, not doing what they're supposed to do. Marshall Roar Cayman says, take the papers, yo, and let the lady go on. And I want to know what she's being served for. So do I. Marshall says, crazy woman, you've been served. Take the damn papers and shut up. It's not your business to question the person serving you. John LaRue says this was just plain rude and ignorant. Maybe she's doing it because most Caymanians think it's below them. Pathetic. I don't know that that's the case, that most Caymanians think that way at all. I think Sherry Ann is not the average Caymanian. She's a bit of an enigma. Peridot, Matt says, Sherry is so messy. How ridiculous that she thought every Caymanian would agree with this. Philip Ebanks needs to consider finding a new campaign manager. She is so embarrassing. And of course, I didn't know until yesterday after this went up that Sherry Ann was all over Phillips. I thought she was just helping him door to door, which she has done with other candidates in the past. I did not realize that she was actually like a proper, like she's on the stage with Philip. Philip, do yourself a favor and deal with this situation. This is not respectful. Candidates, this is where you guys need to be careful who you have affiliations with. The people that you have getting up on your platforms, the people that you have going and doing your door to door. This is a problem for him. And I think that Philip needs to address it. So apparently he had a meeting on Saturday, which we aired last night. Please go watch it. But yes, there was Sherry Ann, big and bold on his platform. And it looks like she spoke, looked like she had a speech in front of her. I don't know what she spoke and what she had to say, but come on. Say what? This is too much. Really and truly. Petty and immature. She is a certified bully, says Mirstar. Miss Brenda says, I heard it was a government survey. Well, you wouldn't serve a government survey. So that doesn't sound right. And looking at what the document looks like, I mean, I don't know what the document is. I can certainly try to find out, but a survey, you don't normally serve on people. You ask them questions and, it's also an offense not to answer questions, but that doesn't look like that's what was going on here. And I can tell you what, when it comes to government surveys, that division, which is ESO, they only hire Caymanians to go out and do that. And they do try to hire a lot of Caymanians. Again, they have had issues. They've had to get rid of Caymanians, even my own family members, who shall remain nameless, but y'all can figure it out real easy. The ESO have had to, because this is, again, y'all Caymanians talking about you want a job, you can't find employment, blah, blah, blah. But when even government gives you a job, they're going out there to people's doors that they've had issues with and trying to make it personal and trying to make it a vendetta, right? You're just an ESO person to take a quick survey, whatever, and y'all out there being the messiest you can possibly be. Strong Wilt says she forgot that she's married to a foreigner, and there is that as well, people. You can't go around talking about jobs for Caymanians only when you've married a foreigner and obviously they had to get a job in your country. Let's be fair now. Jamila says, and she is so cheap. Want to pay me $15 for my services? I told her to keep that. Oh, Lord. No, sir. Wow. It's all coming out here this morning. OMG. No, man. Mayor Stein says, if there was a Caymanian serving her those documents, she wouldn't dare try that because I'm sure they would slap her teeth out. Rude. Sometimes Duppy know who to frighten. You're right about that. One Love says, Sandra, when serving someone, you don't have to explain yourself. Listen, service is simple. This is being served. They would like for you to sign it, but if you refuse to sign it, they can literally drop it at your feet. Then they do an affidavit to say that they tried to affect service and they would not accept it. And this is what happened. And the courts will accept the affidavit. You've been served. Al Brack Cayman says anybody said the correct word, and the correct word is discrimination. Simple. It's very, very sad. It's absolutely horrific. Malachi says, I think that this is so sad to observe how certain nationals are influencing Native Caymanians into believing that we should become an anti-certain nationality and lose focus on the true position, divide and conquer, and then take over, while we're focused on one nationality instead of focusing on the situation in a holistic manner. And I don't, again, whatever our feelings are about immigration, I am Team Cayman, Caymanians first. That doesn't mean that I'm anti anybody else, right? Caymanians, qualified Caymanians, Caymanians who wish to work, we come first. It's as simple as that. And I respect that for any country. If you go to Jamaica, Jamaicans come first in their country. If you go to the United States of America, Americans should come first in their country. That is how it should be. So, Cayman, this is the Cayman Islands, Caymanians should come first. Now, we know that there are more jobs than there are Caymanians who are capable and willing and wanting to do those jobs. You don't go around hating on people. You don't go around calling people names. You don't go around interrogating people about what you're doing in my country. This is the part that blows my mind, you know. These people are here by invitation. A Caymanian has taken out a work permit for them. So you have an issue, you take it up with the politicians. If you want to say, well, we don't want anybody in our country, you go deal with that. But you know, the funny thing is that some of these same people who have this kind of, they're going to record it and put it out there. Who you think that they're hiring when they need something done? If it's not a foreign worker themselves? Come on. Gabby says, but Sandy, she shouldn't business with Caymanians not having a job. She needs to try to stop babying Jaron and tell him to go to work, to be honest. I mean, he's another perfect example of someone who's had job opportunities and unfortunately did not want to do the work. He wouldn't show up to work. Every job that that boy has had, he's gotten fired from. So I'm with you, Team Gabby, that maybe her focus needs to be not why this Filipino is working, but why you need to ensure that your son can keep a job. You need to counsel him. You need to talk to him because he's the one showing up to work with sticky fingers. And even when he had sticky fingers at HSA, they still gave him a second chance. You can imagine. These are the Caymanians that make it bad for all of us, you know. Gave him a second chance. Then he turns around trying to floss on social media, gone overseas, traveling with the wife to be going to pageants. You're not living that kind of life. You're not a kept man. All them baby mamas you got, all 10, 12, 13, 14, 15 of them, they need for you to be working. Those are Caymanian children that need you as a father. They need you to be employed. They don't need you to pretend to be sitting on social media, pretending to be something you are not. Most of us have to get up. We're not independently wealthy. We have got to get up and go to work and hustle and work. And we might only have one or two mouths to feed. Honey child, you got a lot by all these different women. Get him a job, Sherry Ann. That's where you should be focused. Try and knock some sense into your own son's head. The Zoe says, like they always say, pot cussing kettle, right? Pot definitely don't need to be cussing nobody in this situation. Mersar says that I can assure you if anyone treat her expat husband like that, she would be first in line to fight these people. Disgusting. Goes on to say, Sandy, stop it. She enables her son's behavior and everybody knows that as well. Black Coffee says, I hope that she's seen these comments. Justice will be served, says Sandy. Do a survey and how many Caymanians are ready to do landscaping and janitorial, please. Expats need to stop cleaning HSA and government buildings and let Caymanians do it. Just saying. Exactly. Yeah, that's not what y'all want to put on a necktie and a shirt and go sit down in the bank and air conditioning all day. And you might be making less money than some of the other workers, but you don't have business with that. Unapologetic says they can't just drop it at her feet. They can drop it in the threshold of the door, which you have considered being served. Yes, then an affidavit is then required to be completed. YouTuber says her name is always in the mix. What a mess. Oh, Maria, good morning. She says, what a hot mess she's gotten herself into this time. Caribbean Aviation has a very good point. This is the same woman that Chris Saunders put on the business staffing board. Heard she is a hot mess in those meetings and adds no value. And I have heard it as well. And let me be very, very honest. Chris Saunders was trying to pay back political favors and otherwise, right? So every woman, I guess, that he was sleeping with, he had to go put them on a board. Y'all need to shape up with these board appointments. That's a whole other hot mess. And it's embarrassing when you put certain people on boards. This person said, I heard that her marriage was a marriage of convenience. He has to pay her to be married and here in Cayman. That's what the streets are saying. Well, I tell you what, at the end of the day, she was dating someone about 2 weeks before she married this guy. So that's all I can tell you. I don't know what the arrangement is and who's getting what and what's getting what. But yeah. This person makes the following observation. Give me 1 second. Let me just screen grab this. Let me just screen grab a couple of these so we can read them together. 1 second here. What a mess. Yes, my apologies. Someone said the correct term is Filipina, not Filipino. Yes, they do have. Sherry Ann has 2 permits for 2 ladies that she charged them and they're working for someone else. Tell her to talk about that. They are from Rotan. Oh, snaps. So she holds permits for people in her own country? Is she asking them why are they taking jobs from Caymanian? This person says, would she ask the same question to the ambulance driver that came to help her? God forbid. Yes, come first, but in your own country, you must still follow the laws, rules, and at the very least, simplistic civility. So this person says that she's not his campaign manager, Armando Ebanks is, and she's just a canvasser and helping out, then you should not have her on your platform. Good morning, caller.
Good morning, Sandy. I usually got some interesting problems to talk about. I just spoke to Jenny. Let me get her name here, Jenny Powry, who lives on the road just past where the little bakery used to be, right across from Spanish Cove. The road comes off Conch Point Road. That road was, I think it was like about 12 feet wide. Behind where the bakery used to be, I think it's now called Kitty Cove. The Barnetts owned that, and Mrs. Bowery told me that Dart just bought that, and he also owns on the other side. So yesterday or the day before, one of the Dart men, people came down, and he demanded the people from NRA to widen that road to 20 feet to 30 feet. And that is something that's hard to believe that he can dictate to people as to what is going on. But anyway, when, priorities is very important. Spanish Lane needs to be fixed. Did bypass that. Bamboo Close and Bamboo Close and Gorse Lane. People live on that street. This street nobody lives on this street. Where are the priorities? It's sad. When Dart can build his own roads, why should we build Dart a road?
Okay. I mean, I'm not familiar with it, but I can tell you what, when you started talking yesterday, the NRA did reach out, but I told them that we didn't get to hear the full thing. But we will look into this and I guess find out what's going on. I doubt that they would be building a road for Dart if it's his road. First of all, the NRA doesn't really get into the business of building private roads. They only do public roads. So I don't really know.
But Sandy, when it was initially a road there, it was no more than about 12 feet wide. And they took the scraper and scraped up all the old asphalt that was there and put it to about 18 or 20 feet. And now the road is 30 feet. And nobody lives there. Mrs. Powry, she lives just at the end of that road. And says the small road had been constructed for about 38 years, and she's been living there at the end of that road. And she talked to every government official. What's his name? I can't remember. All of the people that were in government from over 30 years ago, and nothing was done until now. She says it's all political.
All right, let me see what I can find out about it, Mr. Dexter.
Okay, I like to ruffle people's feathers when I'm right. I mean, this is wrong for her, for them to bypass the roads that where people are living on, and build a road for somebody can afford 1 million roads.
Yeah. All right. Let me check into it. I appreciate it.
Okay. All right. Bye.
Yeah. I mean, we need to get the facts surrounding this, because I can tell you, as he rightfully said, obviously the DART organization can afford, and I've never seen them trying to freeload off of government for a road. I mean, they can afford it, Yeah, I don't think they're worried about building a road. So let's find out what's actually going on, because sometimes we think we have the information and we may or may not. So we'll get the facts from NRA and I'll report back, and we'll take it from there, Mr. Dexter. So Black Coffee, thank you, says, thanks for dealing with this issue. We need to protect you at all costs. Irvlin says, yes, you can drop it at their feet and run. JJ says that lady was probably scared to drop it based on the behavior of the lady. You can see that the process server was very intimidated, which is wrong. Lord Jesus. No, sir. Shall we call Sherry Ann this morning? Shall we give her an opportunity to explain herself? Strongwill says, Sandy, and she treat the poor husband so bad. Her husband? Oh, Jesus. What a mess. People are telling Dexter, please call back. He called yesterday, so that's why I didn't interrupt him again, because I do know that he called yesterday. So I wanted him to just finish what it was, because NRA reached out. Listen, they're listening. And I appreciate the department agencies that are proactive, because they reach out and said, we heard Mr. Dexter say something, but we couldn't quite. And I said, well, unfortunately, I asked him to call back during open mic because we were, dealing with something else. So he explained it today. So hopefully we can get behind it and see exactly what was going on with that and get some clarity. We'll get the facts. Do y'all want me to call Sherry Ann? She's not going to answer you. Do not call her, says Black Coffee. Show of hands. Yes for calling her. No for leave her alone in her misery. But I have clarified that she's not the campaign manager. Apparently she does canvassing and stuff. Why she's on his stage then is a really interesting question. And I think that Mr. Phillip, the best advice we can give you today is to not have this woman even canvass door to door for you. This is not good. All right. So it looks like the yeses have it, I think. So let's see if she'll pick up the phone. What is her number? Let me look it up. Sherry Ann. I think this is her.
The number you have dialed is not assigned. Please check the number.
Well, I may not even have her number. That should. I spoke to her. Let me see now. Sherry Ann Bodden. This is probably not her correct number anymore. Somebody got Sherry Ann's number? Shoot it across to me. Yep. I mean, I don't really talk to her, so let me see here. Somebody send me her number because it looks like that's not her number anymore. Somebody said that's the number, but it's not assigned. Is it only WhatsApp? Well, let me see if we can call her in WhatsApp then. I don't know. Yeah, that's the number. Okay. Let me try and see if it's a WhatsApp only number. Sometimes that happens. Mm-hmm. All right, no answer on that number. We have another one. Let's try direct dialing that one.
Sorry, the number you are calling is unable to accept your call at this time. Goodbye.
Okay.
Sorry, the number.
Let's try another one. She looks like she's got a couple numbers. Okay, 5740. Mm-hmm.
Sorry, the number you are calling is unable to accept your call.
All righty. So there you have it. And you know what is, somebody says you are blocked. Oh, all my numbers are blocked. Well, she does have a real estate company as well. And so this even got me to thinking about, does she discriminate for her real estate company? Does she tell expats that they cannot rent from, her, they can't purchase property from her? Does she refuse to take money from someone just because they're an expat? Voyager says, I dare say that if the majority of work permit holders on this island were Filipinos, we would have less crime. Strong Will says, Sandy, she's going to be rude to you. Leave her alone. What a mess. It's unfortunate. It really, really is. Sherry Ann is a big woman, and I think she must have forgotten how old she is. She's got children, she's got grandchildren, and we all have to try to make our way in this world. One day, a Filipino might be in a position to hire one of her kids. Relax, woman. Some additional comments. Someone says, this is a simple case of deflection. It seems like she is using the fact that she's a Caymanian to downgrade another person who is an expat. When people feel embarrassed, they often deflect and shift the focus away from the actual issue at hand, which is that you're being served. Caymanians need to realize that in every country, a variety of people are needed to work in different industries for the country to function smoothly. This includes everyone from those in basic entry-level positions to high executive roles. While many Caymanians aspire to work in office environments, we must ask, who will take out our garbage, fix our roads, clean our buildings, and care for our children? Where is the pride in contributing to a good life rather than trying to impress others? Wow, very intelligent, reflective comments there. This one says, I done hear a person saying that they'll never vote for anybody associated with the Sherry Ann. Sad, sad, sad. Why would anybody want her on their platform? I wonder how her cronies and her chat group feel this morning. Oh, she herself need to get a job and stop looking for politician handouts and effing just to sit on government boards. Dun, 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 dun. Somebody else said her tenant in her little apartment is a permit holder. So what's she talking about? What you talking about, Willis? Honey child. Defend yourself this morning, girl. Explain it to the people. I'm giving you an opportunity to do so. We'll try one more time. Now, here's the thing. She's not going to answer. You know, in my mind, if you're going to be so bigoted with people and you're going to record them, you should be in a position to come and defend yourself. Speak to it. Explain it to us. Maybe there's something that was going through Sherry Ann's mind that day, as somebody said, Mount Champion coward is not going to answer. Come, honey child, if you got mount, and I'm a person who has a lot of mount too, and so I believe that, you know, you support whatever your position is that you're going to take. Be able to speak on it. Defend yourself. Now, here, unfortunately, is what needs to happen now as a result of this, right? I saw your comments. I was actually spending a little R&R yesterday. I got to be honest, I had some people visiting, so I was showing them our beautiful island, our Caymanians, and so we ended up going to one of the local resorts, hung up by the pool for a little bit. Child, I was napping on the lounge chair. I took me a little nap. They were like, girl, you were out in tutus. We did not want to disturb you. And so they allowed me to nap. When I woke up and I saw how this video had blown up on Facebook alone, I haven't even checked Instagram yet, but on Facebook, it had like almost 400 comments when I checked it yesterday afternoon. So this is something that not only should she address, but unfortunately for poor Philip Ebanks, who's running in Red Bay, and has her going door to door canvassing. Philip, she has now put you in an untenable situation where you need to respond. Because this reflects poorly on you. You understand what I'm saying? Does this mean that you endorse this kind of behavior? You know that this is how Sherry Ann is. I think that you need to make a statement. You have got to now say something about this, Philip. You can't allow this, unfortunately, to go unanswered. You know, the sad thing about this is that Sherry Ann is not a stupid person. She knows this is campaign season. She knows that she's helping Philip in whatever capacity it is that she's helping Philip. She should have equally understood the implications of if I go out there and do certain things that cause people to criticize me or cause undue attention to myself, that is actually going to reflect poorly on not just me, but anyone that I am dealing with in terms of the campaign. Justice says, can I see a picture of Sherry Ann? Hold on. She's actually behind me. That's her right there. So you mean to tell me Sherry Ann didn't think about this? She didn't think that if I go out there and make us think about anything right now, this is going to come back on my candidate of choice, the man that I'm out there endorsing? She actually supported him, nominated him. I'm just not understanding this. To me, this is actually very, very illogical. It's unfortunate. Here, I got a better picture to show you. It is very, very unfortunate, and I don't know what she was thinking. You know, I can tell you this is who she is. Don't have her ask. I mean, they say when somebody shows you who they are, make sure you get it the first time. So it's unfortunate, but this is who Sherry Ann is, and this is how she's always been. You can dress up some people, but I can assure you, you still can't take them anywhere. And some people are all about just putting on a pretty face. You know, they're not necessarily good people. They're not real people. They're not genuine people. It's all about the attention for them. And unfortunately, it turns out that she is one of those individuals. Once she's looking good and can dress up and put on clothes, like my aunt used to say, pretty face and dirty behind. She didn't mean literally. Hopefully you're washing that, but she means like figuratively. Like you're just a mean, dirty person. And it's so unfortunate because I know Sherry Ann is, like I said, she's not a stupid person. You know, she could do so much better than this. And so it's just sad that she has caused this negativity, my apologies, to follow her with every single thing that she does. All right, here's a few pictures so that you know who she is. All right, that's her there. Maybe one more. Sometimes she looks a little bit differently because she does have different wigs and hair pieces, I think, that she wears. Here's one with her and the husband. This is another wig style. Is that the one that she's married to now? I think so. He's from Rotan, I believe, the Bay Islands. And there she is with Jaren, her youngest son. So she's got 2 boys. Risa says, didn't she nominate him? Thought I saw her sitting with him on nomination day. Yeah, she did. She did nominate him. And so this is the part, once again, that is like, irks. Mayor Star says, call Philip and see if he answers. Wonder if he'll be defending her again. You know, the question, ironically, was put to him when he was on the show on Friday about her. And he said something that I'm here. I'm not trying to pick any fights with anybody. So he was trying to compare her to me. Now, y'all know that I was insulted, right? I'm like, please don't compare her to me. Let's not do that. But the comparison, he's like, oh, you know, she's well known in the community. Yeah. It's one thing to have a loud mouth and everybody knows you for that. It's a totally different situation to be of more substance than that. I'll take it. I have a loud mouth, but I'm also a person of substance, and I don't sit down just saying shit to be saying shit. And the things I do, I don't need any attention. Miss Priscilla says Philip cannot be held responsible for her behavior. She's an adult. He's not responsible for her behavior, but he will now have to respond to this as someone who is working within her campaign. And so, you know, this unfortunately is what these candidates need to be aware of. They can't affiliate and associate with just anybody. You're running for political office, and the people that you have surrounding you, if they are acting out or they're acting a particular way, you got to handle the situation. To be fair, it's the same situation that happened at Kathy's meeting that we were demanding an answer from Kathy, were we not? How can you let this woman take the mic and go on your platform like this about her sister? Some of you were calling out Nolly, which we got to check on him, see how his procedure went yesterday, about the same sort of thing. When he was telling Carrie he can go to the Brack and beat her up, and he was there waiting to beat her up at the Brack dock, people are like, no, hold on. This is not becoming of someone working on your campaign and endorsing you. And I keep telling these candidates, be careful who you have working for you. So yes, Kate, I agree that the response that we got from him, he seemed to have been defending her. So he's got to take some accountability. That was even a week ago. And look at how she has now embarrassed him. Actually, and the funny thing is, this video was sent out before he even came on the show. I didn't post it immediately. I didn't even watch it. And so here we are now with his campaign being tarnished and negatively impacted by her. And she did nominate him. So unfortunately, that says a lot. Speaking of, let's wrap up a few things here. Speaking of a few things, someone said that Kathy Wilkes, speaking of Kathy, was not at the debate last night. So listen to me. I want to clarify something here. So apparently the what's it called now? The Radio Cayman has decided to do their own debates. I don't know when they made that decision, but from all of what I can understand is they made it at the last minute. I haven't watched it. It started last night. Now, they know the chamber has been doing these debates for 9 election cycles. That's a very, very long time. That's going back to when? The 90s or 80s or something? 90s? So they've been doing this for 9 election cycles. Radio Cayman decides to jump in on it, and they're going to have the debates at the exact same time that the chamber is having their debates. I don't agree with that. I don't think that makes any sense whatsoever. So last night they had West Bay candidates, and it seems like they're bringing them because I saw them with I saw Ralston on there, that West Bay North group, but then Jewel was also there. So was it everybody in West? Like, how long are their debates for? Can't be a very intense debate if they're doing all these people. So someone said Kathy and Jewel was to go on Radio Cayman after West Bay North, but Kathy had other plans and told them that she was not there. Well, here's the thing. The team reached out to, and I'm going to be fair to people, but the team reached out, did the invitation, and they said, this is what one person said, it's the Radio Cayman team sent the invite out originally in February to our PR team, but then announced to hold as they were changing the format and the dates. Nothing was communicated until last week. So come on, Radio Cayman. This is not fair. And it's not fair now to tarnish a candidate who just found out about a debate last week and already had plans to do something else. Irvelin says Radio Cayman is shady as hell. And on this occasion, I'm going to have to wholeheartedly agree with you. So the team expressed that Kathy would not be able to make it because she was committed to the youth event because, the TCCP has said that they are really focused on getting the youth involved in this process, and they're trying to do it the right way. They have Leanne Tibbetts heading that up. And so Kathy and Andre were actually at that event supporting the youth. And so she, her team expressed, no, we can't make that date, but we're happy to try to accommodate another date. And they told her no, that they could not accommodate any other date. So I'm not holding this against Kathy. All right. So they didn't get back to her. Nothing was communicated until late last week. And by then, we had the youth council meeting planned. This was important because our manifesto incorporates the feedback from the youth council. The fact that OC wouldn't mention the efforts to reschedule shows bias. Sad that the people think the youth are not important and I should have canceled with them. Then they wonder why young people don't participate. So where's my gavel this morning? Radio Cayman, you're on the losing end of this one, honey child. Shame on you. OC, the least you could have done was express to the listeners why Kathy was not there. She posted on her social media about the events. Of course, the Youth Council also posted their own pictures as well. Listen, this is crunch time for everyone. You can't plan a last-minute debate and days beforehand telling people when they must show up. People actually have meetings already planned. They're already advertising meetings. They're doing all sorts of stuff. Here are the team members there that showed up for the youth council meeting. So there's Andre and Kathy and some of the other volunteers and young people who are trying to get involved in this. You have to, I think, be respectful of people's time. And I understand that Kathy actually opened the meeting with prayer and opened the meeting with some opening comments and stuff as well. Get it together. So someone says that it was unfortunate because they actually had a very interesting and different segment. It's different from the chamber, but they still found it to be engaging and useful. And again, why have it at the same time? Like, you don't think that they thought about, oh, the chamber who's been having theirs and hosting theirs forever, you know, is having it and it's going to be a conflict? Did they even look at the chamber schedule? What if some of the dates that they're asking people to come in, they're not available because they're on the chamber one? You're going to do what? Expect people to come in? You can't split yourself in two. So Roar came on, says, whose radio came on to implement that last minute? I mean, it seems a bit unfair. Roar went on to say that she was at the youth thingy for TCCP where she was supposed to be. My apologies. He says she's winning that seat. Get over it. Sabotaging the youth. Boo, says Irvelin to Radio Cayman. Shame on them trying to destroy that woman. Miss Brenda says Roar Cayman, the Radio Cayman, the formal media house of the Cayman Islands, where people go to hear what's happening in our country. Well, Miss Brenda, I can tell you that they had nowhere near the listenership that that were listening to the debate for the debate for the Compass, the forum, the candidate forum. And they're not formal media house. They're just like any other media house in Cayman. They're owned by government. That doesn't make them the formal media house. They're just owned by government, which also means that they're controlled by government. So keep that in mind when you're talking about Radio Cayman. There's a lot of things that they don't do and that they may do that's being, controlled by government. Elizabeth says, let's see how many people get in their feelings and call Radio Cayman biased now for what they did. Because apparently only CMR is biased, rolling my eyes. Ay, what a hot mess. Wow. Roar says, then give the people sufficient notice. The move is biased. End of story. Jasara says the youth come first, and I'm going to agree on that front for sure. Yep, it is what it is, honey child. So some of you have been, again, circulating stuff to me. Dr. Frank continues. He's sending out letters that, that were served on him years ago. I started litigation with Dr. Frank and Margaret Ramsey said, Sandy, some people you just have to really try to ignore. And I'm doing my best to ignore these people. But I have come to the conclusion that some people, the more you ignore them, the Hunters of the world and the Dr. Franks of the world, the more they're going to try to take certain liberties with you. And I assure you, I can put this to bed very, very quickly. Just like Dan Scott did. I got to give him credit. One way to put it to bed is to simply take their behinds to court. They don't have a pot to piss in. It's not about that. You're never going to get a dime for Dr. Frank, and you're certainly not going to get even a penny from Hunter. And it's not about that. It's about sending a message that you are not going to continue to spout lies about me and just feel like you have the liberties to do that. So I have reached out to some of my legal team. And I will be sending them an initial letter, and if necessary, we will proceed to legal proceedings. Listen, I can do it just like anybody else. I believe that Dr. Frank is not mentally well. This is my honest belief. I think he suffers from bipolarism. I've seen people like him before. I'm not a clinician, so I'm not making any sort of formal diagnosis. Obviously, I'm not in a position to do that. But as a man who will get on his social media and cuss and carry on, then the very next day be listening to my show and want to have a conversation with me and talk about, I'm just like, dude, what is wrong with you? I don't engage with people at that level. I refuse to have that chaos in my life. Right? He's using his social media, sharing letters that were sent to him. So what? Everybody knows that you're being sued. Who cares? And so you can run and go tell him that you're about to get sued again. And this time, I'm not going to be talked out of pursuing it fully. You see, when you try to give people chances, they think you're joking. They think you're playing. They don't think that you're serious. Hunter apparently tried calling the show twice yesterday. And did I say chamber debate? Did I say compass debate? My apologies. Chamber debate, not compass. Oh my goodness. And I want to say to Hunter, he tried calling yesterday and he did not answer when I called. So he posted something.
Sorry, the number you are calling is unable to accept your call.
He posted something about, he was trying to call Wayne Panton to tell him he shouldn't be on my show and this and that. Hunter, let me tell you something. I have cursed you out before. And God knows why I didn't answer your call yesterday. Because if you had come on my show and did that yesterday, I was going to curse you out again. I'm going to give you all a piece of advice. I don't think that we blocked Hunter, but as of today, he will be blocked. I've asked him for an address of service of legal documents. He refuses to provide that. If he doesn't provide it, we know how to find you. We'll show up at your chamber debate and drop it right at your feet. Hunter, I'm not your companion. Don't fuck with me. Let me make myself very, very clear. I'm not your companion. I'll start with you. Since you want to be so fucking bold with me, I'm going to start with you. So you'll get your letter first and you'll get your documents first and go find money to show up in court. That's what you're going to have to do. Forget about your $1,000 that you just donated to the Cayman Islands government. You have time. This is what you have time with. You have time during an election to be worried about me and to be messing with me. You see, let me be straight with y'all right now because I want to show y'all something. I told y'all he was going on this Territories Talk, which y'all know about Territories Talk because of CMR. And this is what we carry. We're the local carriers for this. We live stream it on our platform. And when MP Famous called me from Bermuda about having Hunter on, I said, no, absolutely not. And we're not going to air this episode because I don't want Hunter on my platform at all. This man has been disrespectful. And despite his attempts to try to supposedly apologize, he's insincere in his apology. And I want to make it extremely crystal clear here. I don't suffer fools who think that they're going to play these games with me. I don't really give two rats' ass if you're a politician or who you think you are. We all have to abide by the same laws in this country. If you defame me, I'm going to start to deal with you accordingly. I sit in this seat and I put up with a lot of shit from people on a daily. 95% of it I ignore, in fact. But sometimes you have to stop ignoring people and deal with them with the resources that are available, and that means legally deal with them. Hunter, if you so fucking bold to be posting about me and posting lies and all this stuff all the time, come and tell me where we can serve you. Every time I ask you, where can we serve you documents? The coffee shop is closed. Where can you be found? Why are you hiding? Just answer the question. I'm not playing with you. I'm not playing games with you. I'm a very serious person, you know. And now you're going to see that side of me. You think I'm joking with you? Dr. Frank, instead of you enjoying your retirement and taking your little government pension and going sitting under a hammock, lying in a hammock and under the coconut tree or something, you're just mixing yourself up in too much foolishness. Your legacy is going to be, you know, in the ground. You keep talking about, oh, she hurts my feelings. Who cares? You're a big man in your 70s. Look at how much older you are than me. How is it that I can get in your head about anything? I'm not your problem. Your problem is you. You are your biggest problem. You're in your own head and not in a good way. Go and deal with your mental health issues. We all have them on occasion, and that's where your focus needs to be. Stop focusing on me. Stop hating on Wayne Panton. Stop hating on even Kenneth Bryan, Chris Saunders, this one, that one. The things that upset you, you're upset for the wrong reason. People be trying to help you, and you are the proverbial person that bites the hand that helps you. Now, even Chris Saunders, not that he anybody that we really putting up on no pedestal, but even to him during COVID was trying to help this man get his son back to Cayman because of course he couldn't afford to do so. And he was making arrangements during the lockdown to get his son here, paying for the ticket, getting everything arranged. And you know what this man was out there saying? It was like, come on. When he don't get his way, he starts to act out like a spoiled little child. You're 70-something years old. You're not 12 years old anymore. Risa says, does he have any meetings scheduled? Serve him there. Oh, I got fine, Hunter. You don't got to worry about that. I mean, I'm sure he's on the electors list if push comes to shove. And Hunter, when the Filipino process server comes to serve you, don't record him. And don't be asking them if they got a valid work permit, please, because we don't need to see another video like that. Morning, Anthony. He says, Sandy, is Philip Ebanks entwined with the PPM? That would be ashamed. No, because PPM has their own candidate for Red Bay, don't they? Do they have anybody in Red Bay? Red Bay. I'm trying to remember. Yeah, they have Roy McTaggart. On Saturday, Mario Ebanks was on his stage endorsing him, and the last night, PPM had posted Mario Ebanks on the PPM stage in East End. Has the horse trading started already? Oh, Lord Jesus. I don't know. I mean, some of these people, I don't know if they're being paid or what they're doing, jumping from stage to stage. They're like a flea, jumping all over the place. It's like what happened with poor Heyman. He had Vincent Frederick as his campaign manager. And then Vincent showed up on a PPM stage with endorsing John. And people are confused. They're like, what the heck? What I can tell you that as of this weekend, because we brought that up on Friday, somebody asked the question. As of this weekend, he's no longer Heyman's campaign manager because people don't want that confusion. Gabby says because he's a coward and throws rocks and run. Yeah. If you're bold enough, you see, this is what I don't understand, you know. People want to call me a bully, and it's so funny. It makes me chuckle, right? If I say something, I can stand by what I say. I get here and I say it. If I get it wrong, I will be the first to say, you know what? I got misinformation. I got it wrong. Let me apologize. Straight up. But these people, they want to say stuff. They're going to create their little video shorts. They're going to post stuff on social media. And then they're not even going to answer the phone. They don't have the balls to face nobody. They are cowards. That's exactly what they are. Right? You gonna pick a fight with me and then you gonna run away and hide in the bushes? Don't hide. Because now the gloves are off and I'm ready for you. And I'm gonna, how that song say, Mama said knock you out? I gotta knock your fucking ass out. That's how we can work. And when I say knock you out, I don't mean in a physical way. I'm not about physical violence. I mean legally, you're gonna get a pow, 1, 2, and you're gonna be knocked right down. You're gonna understand and get a feeling. Did I say Roy McTaggart, Miss Brenda? Lord Jesus, Roy Tatum. Sorry. You're gonna get a feeling for what it's like. That yes, you have freedom of speech, but you can't say everything, and you can't say all that you want. There are restrictions for everybody, including me. So be bold with it. What are you hiding for? Face him in the streets. Have him tell me where he can get served the legal documents. I will face him in a court of law. That's where you win battles. I'm not out in these streets. I'm not a hoodlum. I wasn't raised in no streets. Aunt Lottie didn't raise me in no streets. I'm not putting my hands on nobody unless it's self-defense. Now, you're not going to walk up to me and put your hands on me. You're going to get a response. But I'm not encouraging nobody to engage in that. We should be doing better as Caymanians. You know why they're upset and why they're all in their feelings? Because I've called them out. I've helped you, the good people of Cayman, to see them for who they are. Remember when Hunter first started? We were all like, this young man sounds somewhat decent. But the more he talked, the more we saw that he was full of it. The more we saw this man on this very show talking about why he can't fly the correct flag. And we're like, no, Bobo. You got to have respect for your own flag. You got to follow the rules. He has demonstrated to us that he is not a person who wants to follow the rules. So how that gonna work? I can't stand here and advocate for anyone who is not doing the right thing. And then they talk about they want to run this country? Your only accolade you have is you've had 7 failed businesses. That's not quite the criteria that we're looking for elected officials. You're called one day you're defending Cubans, next day you're cursing them, and we're trying to understand where is this coming from? What's your logic? What's your policy? So because you can't properly articulate yourself, you get all upset and in your feelings that I'm the one who's making you look bad. It's like, seriously? Closer to Jesus, my apologies, you just tuned in at the wrong minute, but tune out because we've been going for 3 hours and 21 minutes. And the 5 minutes that we start cursing, just when you tune in. So yeah, you log right back off, honey child, please do. Save yourself the aggravation to your good soul and just log off. No problem. You should have tuned in at 7:30. It would have been good for 3 hours and 15 minutes. Okay? That time done now. Hunter, you're going to get served. It's as simple as that. Don't hide. I don't think the coffee shop is open anymore. Mario said serve him at the coffee shop. I don't think that's open anymore. Come, Stacy. Because as far as I know, they issued him an enforcement notice. And what happened?
I'm gonna go. I'm gonna go see me first. So whatever you want.
This is for Thursday? Yeah.
What do you want that right down here? What you want?
Oh, I don't think I need anything.
You have 3 pack of brownie.
Yeah. All right. I don't think I need anything. I think we're good. I sent it yesterday. You need more?
I need stuff at price.
Okay. All right. My apologies. We're planning the lunch for Thursday for our seniors. So Miss Stacy has to go grocery shopping for that. Y'all be getting on my nerves. Here I am thinking about our seniors and trying to get them fed. Seniors, I'm there again this week, so make sure you come with your belly. Miss Amelia said how they were so grateful and they were talking about how good the food was last time. So we're gonna fix you up with some good pasta. We always try to do 2 different dishes. Of course, we're gonna give you a salad and get some little desserts and stuff too. So Miss Stacy always has to go. I might make my special Cayman dessert because I know they're thinking, Sandy she can't cook no Caymanian food. Not know what I fix. I mean, I give them something different so they feel like they're in a restaurant. But I think what I'm gonna do is I'm gonna make sure she has all my custard top thing because it's a different variation of custard top. So make sure she got all the things for that. But yes, we have a nice meal planned on nice lunch on Thursday for our seniors again. So we gotta fix them up. Full menu. Anyway, honey child, what was I saying? Yes, Hunter, you and Dr. Frank do better. Both of you need to do better. Lord Jesus. I don't know how y'all come on here and be talking about, oh, I just logged on. I don't want to hear no cuss words. You logged on at the wrong time, like I said. Yes, Mary Star says this is bad people time. No, sir. No. No, that's for another recipe. That is the one that he getting, child. All right, here's their menu this week. We do mixed salad because I know some of them got diabetes. They need to watch their diet. We're going to do some creamy pasta, chicken pasta. We're going to do our seafood coconut special. That's going to have shrimp and some hopefully boneless snapper and stuff. We'll put that in there. We got bread rolls for them. We're going to do white rice. I don't think we're going to do any rice and beans because that's too much starch. Because some people will probably have the pasta and then, the sides, and other people might just do the coconut special. And that goes best with white rice. So then we can have some plantains from some raspberry tea. I'm trying to get coconut water. That's the only question mark here because I haven't been able to get any at the farmer's market. So if you have a link up for coconut water, please let me know. And then I'm going to do some coconut brownies. So I've got some stuff sorted out there for them. All right. Dee Dee says, unfortunately, many prominent people in these islands are going around endorsing people they don't even know personally and should be ashamed of themselves, pushing false narratives to the public just for a vote. Unbelievable. Oh, it's a mess. I mean, we have about 6 weeks left, and I really, really hope that the people will try to pick the best candidate. Speaking of that, please go and vote in the poll last night. Michael did very, very well. I listened to some of it, and I know that he did an amazing job answering the questions. The only thing that I didn't like, which is a stylistic thing, he really, you can have the salad, Miss Brenda. Don't you eat salad? I think you'd probably have the salad. The only thing that he did, which is a stylistic thing, is he kept addressing directly Sabrina as the incumbent. And I thought he could have made his point and made his commentary without having to address her. So I felt like that was a little bit like aggressive, but not really passive aggressive. It was outright aggressive. And so I didn't personally care for that style. But he's free to use whatever style that he wants. And I think that the other thing is when you're a candidate and people have certain impressions of you and they say things like, you come across as someone who is aggressive already, I think you need to be careful with that. What people call it, the black angry man. And, it's easy to come across that way. People always feel like, oh my God, why is she so upset? Why is she always yelling? Why is she, So that's the only thing I would say. that maybe he needs to be mindful of. It's something, it comes across differently. All right, let's talk about a few meetings and events that are coming up so that you can mark your calendar. I did see someone say, oh man, I wish that there was like a central place that we could go and see all of the meetings like in one location. And then big shout out to Daniel. He said, oh, well, that's actually a really good idea. Maybe that's something that you could announce. Not announce. Maybe that's something that you could actually like start like a page with all of the meetings and stuff like that. Obviously, I think it's a good idea. Part of what we offer the candidates, again, the ones who are paying, is the ability to have their announcements. So that's why you see a lot of their meeting announcements and stuff like that actually on the platform. So tonight is Savannah, by the way. So please come out to stay in the comfort of your home and log on to both YouTube and Facebook at 7:15 p.m. is going to be the event for Savannah. Now, I understand that Aussie, nobody sent me this, but Aussie's having a meeting this evening at 111 Beach Bay Road. I didn't see any flyers or anything for that yet. Let me check my emails. I haven't really checked emails today. So go and vote. And somebody said that they thought that Sabrina actually performed well also. Let me open up my emails. Give me one quick second. You're doing so good, and now you're gone and made Hunter and Frank seniors. So I'll see if I can get you some coconut water. When do you need it? Thursday, please. So Thursday morning, if we can get it, we can take it for our seniors. That would be fantastic. Thank you so much. Some of them can have a little coconut water. That'd be really nice. Thank you. Let me see here now. I don't see any announcements coming in for his meeting. Do you have a flyer or anything? I don't see anything. Where did they post it? I don't see it on their Facebook. All right. So this evening, Aussie is having a meet and greet at the 111 Beach Bay Road. So again, go ahead and get that. Let me see here. Aussie. Let me just see where I just saved that image. There we go. All right. So 111 Beach Bay. This is Aussie. That's this evening. Then we have Kathy Wiltz, who's having a meeting on the 22nd off of Captain Joe and Osbert Road. That's 67 Viewpoint Lane. And then also they're having a Georgetown Candidates District Rally for TCCP. That's happening on the 25th. When is the 25th? That's next week? Let me see what date that is now. The 25th is next week, Tuesday. So a week from today, they're having a rally at the top of Tropical Gardens Road. Good morning, caller.
Morning, Sandra. I
Hey,
wasn't
honey.
going to call in, but yes, what you just said about that forum last night, I agree with you 100%. Because I was watching that and I said it was a good forum, but I noticed that stuff that Sabrina was saying, he kept like hitting on her. Other stuff that Crystal was saying, he was like agreeing with her, but everything, it was something that she said.
It seemed a little bit personal in a way, and I didn't like that.
Yes,
I mean,
yes, it was so, and I was saying it's so sad that she can't answer back, but I guess it would have been like
a back and forth. Yeah.
And it was something she said like 3 times. I can't remember what the word was, but he kept hitting on that.
Well, one of the things she was talking about, and I don't know how much she explained it really, because I was kind of listening off and on. We had some guests, but she was talking about the necessity to have data, and we say that here on this program all the time, that we have to have data-driven decisions.
Oh yeah, the data.
Yeah, and he kept going, "Oh, we have enough reports. We have enough reports. We have enough data. We have, I don't know what the previous minister is saying." And the funny thing about it is, one prime example, and this is maybe where she needed to come back and rebut him the next time she mentioned the whole data point, is we actually have, remember how they did the health survey? That hadn't been done in well over a decade. How can you talk about you have data when the health survey, which her government and she was spearheading, pushed that through so that we can take the health and the pulse of the country. And then we can see that the health issues that we're having is costing this country over $25 million. That data is very important to have. So I think that she needed to circle back and address him. Yes, we have previous governments have wasted money and they have had reports, but this government didn't do that. We came in and we did a survey that hadn't been done in a decade. We had no updated information on the health of this country. That's how she needed to come back. Listen,
and
they
then I
need me to help them prepare for these debates, you know. Because trust me.
I agree, like he was kind of aggressive. Then another thing I didn't like what she said, because I went to her meeting one night, and when she was talking about the flooding down in there, one person was sitting by me, and they live down in there, and they said yes, that their road used to flood terrible, and after she got in, that they put this pump or whatever she was talking about. They never had flooding, because I used to hear my husband always saying that Prospect is a place that he wouldn't take a piece of land if they give it, because it was always flooding. And then I'd say to him one time when happened here flood, I said, well, Christ, you were just as bad. But anyway,
here's the thing too, right? This is the reality of it. Say what you want to say, but one of the things that Sabrina has said time and time again is probably the hardest lesson that she had to learn when she went in there is that as a minister, you don't have as much say as you think. Now, it is interesting because everybody has solutions until they get in there. Then they find out how difficult it is to affect change and to get things done. She's already been in there, and she herself has had a reality check of what it takes to actually get things done within the system, because you have to work with the civil service. They're the ones who execute things. So all these people have solutions for flooding. And I can tell you that the flooding problem in Cayman will never, ever be solved. We are too low-lying. You can have a drain every place. If we have enough rain, this island will always flood. These MPs need to be honest with people. They need to say, we've had reports.
The saying is, things are easily said, but not easily done.
That's
right. And some of them think that when you get in there, it's a quick
right. That's
so
why I also chuckle when they say.
Sometimes you might even find a fix. You'll try, but then this is what I don't understand with people. I tell you, like my all the time, people gonna be people, and you can't change them, and that's true.
Yeah, but it's like when they go in there, they gotta fix it. They gotta fix it in 4 years. They gotta fix it in 4 years. When they get in there, they see that number one, they might not even have the money to fix it because the previous government wasted $100 million on a black school.
They can't fix it as easy. So then they say, put your spout where your mouth is. That's why I don't understand. It's not an easy fix thing, but people be trying to do their best, but sometimes it's impossible for you to get it fixed, or it takes time. But then this is why I don't understand why people, and then while saying with this campaign and thing, I don't think that nobody should be criticizing nobody to talk about the stuff that we need and the stuff that they will try to fix, or maybe they can fix, but why bashing each other? Because like I say, everybody have a part. There's no perfect human being. Only God is perfect. And why this one? And then in this, like you tell the truth, well then this is way down here. Because people that you taught that never had nothing, then if you access on me, then something come up on you. So that's why they should just focus on that.
And here's the thing. Here's the question. This is the question that I would have had. And I mean, that's why when people say it's not a real debate in a way, it really isn't. Because here's the thing, right? When they talk about how they're going to fix the flooding problem, the very first thing I would have said in terms of a rebuttal. And again, if you candidates need help on how to answer questions, maybe y'all need to reach out to me. I can offer that as another service, because you know what I would have said? I said, it's easy for people to tell you they're going to fix the flooding problem. Ask them what their position is on development in this country. Does the CINP government have a position on development? Are they going to curtail development? Are they going to be the pro-environment party? Are they going to put the environment first? Because if they don't do any of those things, the overdevelopment contributes to more aggressive flooding, and it contributes to moving flooding in different areas. So don't ask them about solutions to flooding, because that does not operate in silo. That doesn't operate by itself. The worst thing of the flooding is dependent on different things. If we keep ripping up mangroves, what do you think is going to happen when hurricanes come? So ask them about their environmental position and their position when it relates to planning. Because if they keep putting planning ministers in there who are all about development, big developers, more and more and more and more, and they keep fighting the National Conservation Council, they try to tear down the National Conservation Act. How are those people going to sit down and tell you that they're going to resolve your flooding problem? They can't do nothing about it. They're going to simply make it worse. So y'all need to pick sense from nonsense when it's easy to say people have solutions, but let's talk about the practicality of those solutions in the bigger picture context. That is what matters.
And they get there and they see that they can't do nothing, then they're going to see it as easy to do as it is.
And poor, it's unfortunate that the PPM candidate, she just flopped. Poor her. Everybody was like, oh my God, she's not ready. She can't. I felt so sorry for her. I guess she did the best that she could. I don't know if they helped her prepare, whatever. But someone said to me this morning, this is a perfect example of why the progressives is not going to carry the government yet again, because they're simply not ready. And a lot of the new people that they brought out are not ready. Now,
I wasn't listening to Dan.
Ms. Shelma, let me say this. A debate, an election is not won on a debate alone. Because some people have the gift of gab and they can talk sweet. What they say, you got a sweet mouth. They can talk sweet. You need to look, you need to look at the bigger picture. It all matters. So yes, for me, a debate and the big equation, a debate is maybe 15%, if even that, maybe 10%. I need to look at that person's history, how consistent they have been, and how have they done the things in their lives that they're supposed to do.
Yep.
Because delivery, we want people who are about rolling up their sleeves, pulling up their pants, and delivering for the people of the Cayman Islands. Get to work. No more egos. And that's why I was put off by the aggressiveness that I saw last night, because I thought to myself, I'll tell you what I was thinking. The egos leading with your ego and your aggression, and that you have all the solutions and that you know it all, is why these last governments could not make it. That is part of the reasons. There was too many of them in there leading with ego. And I've got the solutions. I'm the one who has the solutions. They were not conciliatory. They were not willing to bend to each other. And we don't need any more of that.
And they say talk is cheap, but it takes money to buy wine. So
we need people who are willing to work together to find the solution. So you can go in there with an idea, and your idea not a whole water.
Get it done, and they say two heads is better than one if it's even two cow heads. So I don't know.
All right, honey child, thank you.
Yeah, so, I wasn't.
Oh, sorry, Michelle, maybe got cut off there. But I'm going to encourage people to really pay attention to everything. And, somebody else said to me that was the reason. And I don't know anything about Michael. I didn't even know that he had gotten fired from government. I didn't know that. But they said to Sandy, the reason that Michael got fired from government is that same aggressive thing that you see. What he did back in the day is he called in when I believe they said Roy Bodden was his minister. And he called in and took Roy Bodden on the talk show. And that is why he lost his job in government. And so I'm thinking, wow, do we need that kind of aggressive energy going into the government building again? Y'all need to pull it back a bit. Miss Joyce Ann, yes, ma'am?
Yes, sweetie. One thing I want to say, because I think a lot of us forget, that COVID was in for 2 years. Sabrina or none of them got a full 4 years. They got really a year and odd, right? And during that time, I could tell you I lived in Prospects for like 50 years. My road was so terrible I couldn't get out. And now if you come my road when it rained, it's only when it had that excess raining like some weeks ago for constant, and it was gone quicker than it used to go. It would be there for days, but this time it didn't stay so long. Where Sabrina lived, never flood in her area, was never a flood. So when they said that she didn't fix anything in her area because down there don't feel a flood. What happened was that she run the pipes or the tubes there to take the water from where we are to dispose it into a drain on that side. And the resident over there got upset that she had taken it and said that she was only looking out for the poor Caymanians and not looking out for them. So, I mean, you got to understand. Sometimes you hear things, but you got to hear and understand and read through it. And then during the year and all that she was there, all they did was fight. They fight them because they couldn't get anything done, right? And so the things they had on the table they wanted to pass, they were so busy there fighting them that people couldn't get it. So you see, it looked easy to everybody when you're not in a situation. But when you're in a situation, let me tell you something, then you understand. They didn't understand that they couldn't make a lot of the changes without the government. And if the government is not willing to work with you, that's a next humble,
And the priorities. This is the thing too, right? The priorities of the other members. You can go in there with the best of intentions, but if the priorities of the other cabinet members are not aligned with your priorities, you're going to have a problem. So, when someone is part of a party, you're going to be judged by the entire party.
That's right.
So, I mean, kudos for Michael for doing well at the debate. But the question then becomes, you elect Michael, he doesn't even get in because the rest of his party only get 2 members. What is going to be their solution? They're going to sit on the back bench and do what? Become aggressive with everyone? Fight with everybody? We don't need that. We need all hands on deck. So people said that he resigned. Like I said, I don't know anything about his situation, but I was told that what led to him leaving government was the fact that he called in and took on the minister at the time, who was Roy Bodden, and Roy had to deal with that situation. Or the HR manager for that department had to deal with it. So maybe they gave him the option to resign. I don't know, but it was a direct result of him calling into a talk show. So go fact check it. And that's where in Fred, go check it.
And the problem is this, right? If you say you're going to work together for the betterment of our country, you got to start from now. I mean, we're all supposed to be doing the same thing because what? We're supposed to be looking out for the people.
Yeah. To be fair, no other candidate did that. No other candidate did what I saw last night. And we're now on our 3rd debate. And so I think it does say something about an individual's approach to the forum, because some of y'all say it's not really a debate, however you want to call it. It does speak to how you're approaching a situation, if that's how you're doing it. I don't know. All right, Miss Joyce Ann, thank you so much.
Thank you, sweetie. Okay, honey, bye.
All right. I mean, listen, as long as I've been in Cayman, I was thinking about this. I was thinking about this. It's been almost 30 years now that I have been back. It's crazy, but I've always known that Prospect, I was like, I'm not living in Prospect. I rented there briefly, and oh, yes, thank you so much. So yeah, I mean, at the end of the day, it is it's an area that I briefly lived in when I first moved to the island. Just a few months, I had an apartment there. And I was like, no, honey child, I'm not dealing with that. Yes, caller, good morning.
Good morning, Sandra. How are you doing today?
Not too bad, dear. How are you?
All right. Well, with the subject, I hear what you're saying as it pertains to the flooding issues that we experience here in Cayman. And the first thing that I'd like to say on that subject is this. People in Cayman have been fooled into thinking that there's a difference between the environment and us. We are a part of the environment in which we live.
Mm-hmm.
And as a result of that, what we do, for better or worse, we're going to be negatively impacted by individually or as a collective community or society and country of people.
Mm-hmm.
Now, what it all goes back to is a lack of a development plan and the failure, the dereliction of duty of successive governmental administrations to take on that necessary step. Because everything is done ad hoc, everything is done reactionary. You know, and that's a result. I mean, on one hand, yes, you have people who unwisely have chosen to build low in flood zones.
Yeah.
Right? And that's the reason why Caymanian people back in the morning built their houses on stilts. That was one of the reasons.
Yeah.
You know? But that's further been that unwise decision that many folks have chosen to do. Build low in a flood zone. It's been made worse, of course, by the lack of a development plan, wherein you'll have one property on this side, they're low in a flood zone, the next one has a little bit more sense, and also more money to be able to build up higher, and they build up their whole entire property higher, which then results in flooding for the neighboring properties and areas. That is all a result of the lack of a national development plan. So everybody needs to understand this. All those who are incumbents have some level of culpability in not working their tails off to push through the necessary national development plan and at least begin to mitigate these issues from getting worse.
Yeah. Yeah.
You know?
So, and here's the problem too, Jonathan. That's why when people say, oh, we have enough reports, the truth of the matter is we need to formulate the biggest report, which is what you're talking about. This national development plan is one that we do need to spend time on, and we need to get it done. So the reports that we have had have been wasted. We've wasted money on the wrong reports and prioritizing other areas because we haven't had this national development plan done. Why? That should be a priority. That's not an area where you say, oh, well, you know, we have a national development plan, so let's not worry about any more reports. We have to have data to make good decisions. And we need current and updated statistics and data. Just a couple years ago, we didn't even know what the population size was in Cayman.
We have all the data we need. We have all the data we need. We have all the God-given common sense that we need. What we need is to address the elephant in the room is that Cayman is run by greed. The people who are putting their will in are the ones who don't care about the negative consequences.
Well, I agree with that, but I also think that I agree with that, but I also think that there is an ongoing need for accurate information that reflects the current state of things. And we don't have to, you know, the thing that gets me, Jonathan, is we don't have to pay all these so-called experts and $1 million for a report. There are ways to get this information and poll the community and talk to people that is so much more effective. So that's where I have an issue with these reports, is that we're often overpaying for them. We bring workers in from overseas who don't even understand the reports that they're putting together, what it is that we need to actually get from that information. And so from the very foundation of trying to get the information, we're already missing the mark. So that is where money and time is being wasted.
This writing of reports is an industry for certain people.
Exactly.
Okay, and you can, you know, it's been said 1,000 times, you know, you can have all the reports that you want, but if you don't act on it, or if you deny the information and the data that is there simply because that goes against who might be pulling your strings as a politician or as a civil servant.
Yes.
Okay. You're not going to see the necessary positive changes being able to happen. And even if it's just, at this point in Cayman, it's going to be mitigating the issues. The issues are going to exist. You're correct in that we will have flooding issues into perpetuity in Cayman.
Yeah, nobody's going to solve the flooding issue. And again, you know, I think that people want, the electorate want to hear certain things, and you know, that's where they get these unrealistic, you know, promises, because the candidates know, oh, this is what they want to hear. What they need to hear is the truth. And they apparently our people can't handle the truth, because when you tell them the truth, then they tell you that you're bullying them. Thank you, Jonathan. Have a beautiful day.
Right.
All right, darling. One more thing before we end the program today. We're going to start to wrap up here, because Lord knows that I need to earn my keep. And I've got work that I need to get going on. But let me say this. Our prayers this morning are going out to the people of Rotan. You would have seen last night that we reported on a horrific plane crash. Someone sent me the manifest, and I understand now that at least 10 people have died in this car crash, including a young man who was a cultural icon and former congressman, Mr. Aurelio Martinez, 54 years old. It was Lahanza. Flight 018 crashed into the sea shortly after takeoff from Rotan. It was scheduled, I think, to go from Rotan to La Ceiba. And this is such an unfortunate situation. Our thoughts and prayers are going out this morning to the people of Honduras and specifically the Bay Islands. They are did I say car crash? No, plane crash, the plane. What on earth am I saying this morning? A plane crashed. And so, our prayers and thoughts are going out this morning to the people of Honduras. I'm so sorry. This is just absolutely shocking. Of course, as soon as the plane went down, it was not long that we started to receive word about this. We'd received some video footage and we posted it right away, praying really that there would be mostly survivors. But within a short amount of time, they said they had confirmation that 5 people had died. And then it went from 5 to 10. And I believe it was 10 out of, hold on. And of course, in the days coming, there could be more people who actually end up passing away as well. But we were actually provided with the full manifest. I mean, those are small planes, right? So it's not a huge jet or anything like that. And there weren't that many people on the flight to begin with. So really, it's the majority of people from what I can see based on the manifest list here, which was shared with us. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, maybe 15 people. So that means that probably only 4 or 5 people might have survived this. The saddest part is that gentleman there, he was actually earlier in the evening. This shows you how unpredictable and, just shocking life can be. Earlier, hours before the flight, he was actually dancing and having a good time. I'm going to see if I can find the video here. And just like that, within hours, his life was snuffed out and ended. So incredibly sad. Good morning. Good morning, caller.
Oh my God, Lysandra, my heart and my mouth, you just killed me. My niece was supposed to be going to Rotan from Banaka to have surgery on her eye. She told me Sunday that she wasn't going to be. I got a call down and tried to find her. I hope that she didn't know, but well, then I don't know, she was going from Banaka to Rotan, and then she told me she was going to be there.
You hadn't heard about it. Oh my God.
I haven't heard, because she have these 2 things come on the lid of her eye, and they having some American doctors, and she got an appointment, and she told me, Shelma, this was Friday we talked, she said, Shelma, I'm not going to be here tomorrow, because I'm going, and she said, I'm going to be with a friend for 2 days, and after that, then I'm going over to the hotel when they operate on my eyes, and my son coming over from Ceiba, but her son, oh my God, I'm nervous, and she's the one I talked to in Banaka. Most I got to try call down and find out, but I hope it's not nobody that I know anything, but I don't think it's her, because like I said, I don't know, I'm Banaka on the plane, or she was going on the yacht.
So I just want to confirm that the number is up to 12 people.
Oh my God.
So the last I'd heard was 10. It's now 12 people, including this popular Honduran musician.
Oh God, I got
yes.
I mean, my hairs are sticking up on my arm. Oh my God. Oh.
Yeah, very sad.
So if it's not nobody farming to me, I still feel, because I got heart, because everybody, loved one is to them. But anyway, I'm going to call and try to see why.
Yes. Thank you.
Thanks for that, Sandra, because I didn't know nobody never called me nothing.
Oh my gosh.
All right.
Yeah, that's why I tell you guys, keep up with CMR, because nobody else reports these news stories here in Cayman. They just focus on local news. We know that we are a community of diverse people. And so, we report. We're listen, 23andMe tells me I have connections in the Bay Island. We are connected in so many different ways, folks. This is who we are as a people. So yes, unfortunately, a lot of Caymanians would probably know some people who are going to be impacted and affected by this. And I mean, if it's already up to 12 people, my God, that could be practically the whole plane. Oh my goodness. And we just want to extend. So they're saying that one was unable to be rescued. 11 of the dead were rescued. One was unable to be rescued. And so far, only five people are still alive. So very, very sad. But yes, hours before, he was seen dancing and having a good time. They say that he was, a true bridge between the Garifuna communities of Honduras, Guatemala, and Belize and beyond, and had a deep-rooted love for culture, and he connected many generations and geographical boundaries with music and his melody and love for culture. So every life on that plane that has now been lost was valuable to someone. So we are indeed very, very sorry for the family members and the country as a whole who now are mourning such a tragic situation here today. So just unbelievably sad. And I tell you, that's why sometimes the energy that we waste on certain things, it's like when you realize how incredibly short life is, sometimes you got to sit back and really reflect on it. I'm going to show you, this is the video of him, the last video of him taken hours before. So as we can see, he was someone who loved and enjoyed life. Such a vibrant person. Good morning, caller.
I know you're on air, my darling. Mm-hmm. Just reminding you to big up for my son with the clip I sent you this morning.
Oh, yes. I will post it.
Thank you so much,
yes,
honey.
Yes, ma'am. Okay, good.
Thank you.
I appreciate it. Thank you. This one person says one guy was going to his daughter's funeral with his new wife. Now he lost his wife as well, and he was one of the survivors. Oh, my God. How horrible. Oh, my God. And they can't find one female body. Hopefully they'll find her, because at least the family will be able to bury something. I think it's horrible when you can't find a body. Oh my goodness. A family of 4 was included. The mother, the father, and the 2 young children. The youngest child had her teddy bear hugged up. Oh, Jesus. Wow. So 5 survivors, 4 females and 1 male apparently survived. So this is such a tragedy. And it's at times like this, I don't even know what to say. What are you going to do? This is so horrible. But we just wanted to, Emma says, please don't worry. Your niece is okay. She was not on that flight. I think she would have probably heard by now, but yes. I didn't even realize that anybody hadn't heard this, especially anybody with connections to Honduras, because we posted right away. And, as I started to get the news, I said, Renee, please confirm and reconfirm what's going on there in the Bay Islands and, get this up because, yeah, this is just crazy. Absolutely crazy. All right. So sad. All right, folks. Well, we're here to bring you the news. CMR covers regional news. We do, obviously, international news as well. We try to keep you guys as informed as you possibly can be on what is happening around the world. We do not live this is no longer the island that time forgot. We don't live in a cocoon by ourselves with nobody else. We live around people. And so, these things happen, and we need to know that other people are going through situations that sometimes, we need to help them out if at all possible. And sometimes the only thing that we can do is perhaps just send a little thought, positive prayers their way, and hope that they can get through this, because these will be just very, very trying times for all of those. So the tragedy in Rotan is just absolutely shocking. And we stand with the people of Rotan, of Honduras today, as they deal with the fallout from this situation. And we're hopeful that none of the survivors, that they will not lose their lives. But at this stage, we even had the ministry, the National Ministry of Youth in Honduras, announcing that 2 of the sisters on the plane, Andrea and Angie Flores, who died in the fatal crash, both originally from the Saiba. They were sending out condolences to them also, because they were participants in the National Youth Ministry. So just a sad situation. So there's a mother who's lost 2 of her children in the same, young girls, in the same very, very tragic event. All right, folks. Thank you guys so much for tuning in to the program. I appreciate your support always. It was a bit of a tough show today for different reasons, but we can get through it, and we got through it. And so I will see you guys tomorrow morning. We'll have some candidates on tomorrow. The Honorable Kenneth Bryan is supposed to be coming on Thursday morning. So make sure you mark your little calendar with all the dates of when people are coming on, and we will see you guys in the morning. All right, God's willing. Have a good one.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings. Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.